Pleasant good afternoon to everyone. The Committee of Budget, Appropriations and Finance is hereby called to order. Good afternoon to all present, listening, and viewing. Welcome to today's meeting of the Committee of Budget, Appropriations and Finance. Happy Tax Day. Let me say that again. Happy Tax Day. Today is a big day for the Virgin Islands because this is the day that it's called the government's payday. So April 15 marks one of the biggest revenue collection periods for the Virgin Islands government. Thank you to everyone who has filed their returns and paid their taxes, thereby supporting the continuity of government operations. My thanks as well to Director Earle Lee and his hardworking team at the Bureau of Internal Revenue. As a reminder, the Bureau of Internal Revenue offices on St. Croix and St. Thomas will have extended hours today and will close at 9 p.m. this evening in order to accommodate the public. Today, the Committee of Budget, Appropriations and Finance will hear from Dr. Julia Sheen from the Virgin Islands Diabetes Center of Excellence on their operational accomplishments and needs. The committee will then hear testimony and consider 3 bills. If voted on favorably, these bills will be advanced to the Committee of Rules and Judiciary for further vetting. Before we proceed today, I'd like to introduce our new post auditor, Dr. Theodora Phillip. Dr. Phillip is no stranger to the legislature. She joined the institution in 2005 as a chief administrator in a role in which she formulated budget projections in preparation for the annual budget process. In 2010, she transitioned to the role of Assistant Director of Post Audit and served in this capacity until 2018. I welcome back Dr. Phillips' expertise in fiscal policies, financial management of federal and local funds, budget performance and oversight, as well as data management and accuracy. My thanks to Nakia Fleming for serving as the acting post auditor, and to the Post Audit Division for all their contribution to the budget process. Welcome aboard, Dr. Phillip. Lastly, I extend happy birthday greetings to my friend, the lovely and amazing Claire Roker, who celebrated her birthday on Sunday, and I promise not to tell you how old she made. I'm honored to have been the sponsor of Act 8858, which names the Visitor Center at the Annie Abramson Marine Facility in Frederiksted in Claire Roker's honor. I continue to work with the Virgin Islands Port Authority to both complete the naming and celebrate this staunch advocate for women's empowerment, tourism, economic development, and the Virgin Islands, and especially Frederiksted. She is definitely a strong Frederiksted woman. Happy birthday again to Claire Roker. At this time, I'd like to remind everyone to please put your phones on silent as to not interrupt the proceedings, and ask the Madam Clerk to do the roll call.
Good morning. Senator Marvin Blyden. Senator Blyden present. Senator Dwayne M. DeGraff. Senator DeGraff absent. Senator Ray Fonseca. Senator Fonseca present. Senator Novelli Francis Jr. Senator Francis present. Senator Hubert L. Frederick.
Present.
Senator Frederick present. Senator Maurice James. Senator Maurice James absent. Senator Curte Vele. Senator Vele absent. Mr. Chair, 4 present and 3 absent.
Very well, thank you very much, Madam Clerk. We do have a quorum and prepared to proceed. At this time, is there any correspondence to be read into the record, Madam Clerk?
Yes, Mr. Chair.
You may proceed with reading of those correspondence.
April 15th, 2025, to Honorable Novelli Francis Jr., Chair, Committee on Budget, Appropriations and Finance, 36th Legislature of the Virgin Islands, Capitol Building, St. Thomas, Virgin Islands, 00802. Dear Senator Francis Jr., I will be late in attending the Committee on Budget, Appropriations and Finance meeting scheduled for today, Tuesday, April 15, 2025, due to a previously scheduled obligation. I apologize for any inconvenience this may cause and look forward to participating upon my arrival. Thank you for your kind consideration in this matter. Respectfully, Mary C. James, Senator, 36th Legislature of the Virgin Islands. Mr. Chair, that is all for the correspondence.
Thank you very much, Madam Clerk. Please let the record also reflect the presence of Senator Franklin D. Johnson. Good afternoon, Senator. Thank you for joining us. He's a non-committee member, but of course always present, so we appreciate his attendance today. Madam Clerk, please read today's agenda into the record.
Committee on Budget, Appropriations and Finance meeting April 15th, 2025. Block 1. The Committee on Budget, Appropriations and Finance will meet on Tuesday, April 15, 2025, 12 p.m. in the Earle B. Ottley Legislative Hall on St. Thomas to receive an update on the operational accomplishments and needs of the Virgin Islands Diabetes Center of Excellence. Invited testifier, Dr. Julia Sheen, Executive Director, Virgin Islands Diabetes Center of Excellence. Block 2, the Committee on Budget, Appropriations and Finance will receive testimony on the following lease agreement. Bill number 36-0062, an act approving the lease agreement between the Government of the Virgin Islands acting through the Commissioner of the Department of Property and Procurement and the United States Department of Commerce, National Oceanic and Atmospheric Administration for a portion of the telecommunications tower located on parcel R-22 of Tract 1, Estate Nazareth, Number 1, Red Hook Quarter, St. Thomas, sponsored by Senator Milton E. Potter by request of the Governor. Invited testifier, Mr. Vincent Richards, Assistant Commissioner, VA Department of Property and Procurement. Block 3, the Committee of Budget, Appropriations and Finance will receive testimony on the following bills. Bill number 36-0008, an act amending Title 33, Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset a property owner's property tax liability against any amount of money that the Government of the Virgin Islands owes to the property owner, sponsored by Senator Milton E. Potter. Invited testifier, Mr. Brent Leerdam, Tax Collector, Office of the Lieutenant Governor. Bill number 36-0042, an act amending Title 33, Virgin Islands Code, Subtitle 3, Chapter 118, Section 3411, to increase the maximum judgment amount for the award of damages against the Government of the Virgin Islands, sponsored by Senator Alma Francis Heiliger. Invited testifier, Dr. Felicita Richards, League of Women Voters. This ends the reading of today's agenda, Mr. Chair.
Good job. Thank you very much, Madam Clerk. And at this time, let me first of all apologize for our tardy start. We did have, in fact, had a 10 a.m. scheduled start time this morning. However, there was a impromptu meeting at Government House with our BVI delegation that took place, so we had to reschedule and delay our start for 12 o'clock. So again, my apologies there. This time we do have Miss Dr. Julia Sheen seated at the testifiers table, and I'll go to that table for them to introduce themselves, as well as Dr. Ava Roberts. All right, Dr. Sheen.
Good morning, everyone. Good morning, Senators. I'm Dr. Julia Sheen, Executive Director of the Virgin Islands Diabetes Center of Excellence. Would you like to introduce yourself?
And I'm Dr. Ava Roberts, podiatrist, also with Diabetes Center of Excellence.
Thank you. Welcome. We should have a good discussion today. We got diabetes and we got a podiatrist. We also have some folks online. Can we go quickly to our online testifiers so that we could do a quick mic check?
Good afternoon. I'm Dr. Gail Nunley Bland. I'm the endocrinologist that works with the Virgin Islands Center of Diabetes Excellence.
Okay, that's Dr. Bland. Say your name again, please, Dr. Bland.
Dr. Gail Nunley Bland.
Okay. All right. Anyone else? Dr. Sheen?
Yes, we have Shamara Robinson, our
Hello, good afternoon, everyone. My name is Shamara Robinson, and I am a registered dietitian and diabetes educator with the Diabetes Center of Excellence.
Okay, we also have Dr. Ebony Evans, pharmacist.
Hello, hi, my name is Dr. Evans, and I am the clinical pharmacist with the Diabetes Center of Excellence.
And we have Dr. Anthony Oliva, our medical director. He might be having some problems with his mic. All right.
Okay, so we have Dr.
Anthony
Olivia,
Oliva, yes.
the pharmacist.
Yes, and we should have had Dr. Tinyan Liu, our ophthalmologist, but he might not be available because we had the change in schedule.
Okay. Well,
But I have everybody's information in my testimony.
great. Today should be a good discussion and an overview as we continue to endeavor to address the issue of diabetes in our community. And we know that diabetes, contributes to a lot of other chronic illnesses, so this discussion is certainly good. I know that my colleague, Senator Ray Fonseca, the chair of the Health Hospital and Human Services, has been a strong advocate as we continue to educate the public in respect to the diabetes control there. So without further ado, I think you had a presentation or you're recognized for your testimony at this time.
Thank you so much, Senator. Good morning, senators, members of the 36th Legislature of the Virgin Islands, and the viewing and listening audience. I am Dr. Julia Sheen, Executive Director of the Virgin Islands Diabetes Center of Excellence. I would like to begin by acknowledging Senator Novel E. Francis Jr., Chair of the Budget, Appropriation and Finance Committee, and Senator Ray Fonseca, Chair of the Health, Hospital, and Human Services Committee, as well as other distinguished members of this legislature. Thank you for the opportunity to discuss VITCO's operations and accomplishments. I am joined today by our dedicated team, Dr. Donna Christensen, Vice Chair of our Board of Directors, she's on St. Croix, Jillian Jagroup, our Program Manager, Dr. Ava Roberts, Podiatrist, and virtually, Dr. Anthony Oliva, Medical Director, Dr. Gail Nunley Bland, Endocrinologist, Dr. Tinyan Alvin Liu, Ophthalmologist, Shamara Robinson, Registered Dietitian, and Dr. Ebony Evans, Pharmacist. We are also honored to be joined by several of our patients and program participants. Thank you for joining us, Tintin, and on St. Croix, we should have Mr. Douglas. Senators, as you may know, diabetes is a serious public health crisis in the U.S. Virgin Islands, affecting more than 14,000 residents and ranking as the 7th leading cause of death. The territory's prevalence of diabetes far exceeds national averages, with high rates of hypertension, cholesterol, and obesity compounding the issue. VITCO is a 501c3 nonprofit organization whose mission is to prevent diabetes and reduce its complications through education, treatment, health promotion, and research. Our goal is to reduce the burden of diabetes while improving the quality of life for individuals living with or those at risk for this disease. VITCO is located at 4040 La Grande Princesse in Christiansted, St. Croix, and the Roy Lester Schneider Hospital on St. Thomas. We are open on Mondays through Fridays from 9 a.m. to 5 p.m. on St. Croix, Monday, Wednesdays, and Fridays from 8 a.m. to 5 p.m. on St. Thomas. VITCO is relocating its St. Croix operations to the Sime Farm Shopping Center on April 25th and will plan an open house shortly thereafter. VITCO's diabetes clinical services are offered in person and via telemedicine and includes consultations with the specialists I mentioned earlier. Our chronic care management services are where we follow our patients every 3 months and include them in interventions that help them control their condition. VITCO takes a patient-centered approach to providing healthcare services to our diabetic population. We combine clinical services with education, enlisting family and friends to support our patients, and we connect our patients with community resources. We have been successful in building a multidisciplinary team of providers to serve our patient population. We now have Dr. Nunli Bland, an endocrinologist from Howard University who sees both children and adults with diabetes, an ophthalmologist, Dr. Alvin Liu from Johns Hopkins, who screens our patients for diabetes retinopathy, a nurse practitioner, Mrs. Amanda Montero, and Dr. Anthony Oliva, our medical director. We also have Dr. Ava Roberts, a podiatrist who recently joined our team. Since receiving ARPA funding, VITCO has made significant strides in expanding access to diabetes care and education. Over the past year, we've provided services to more than 2,301 diabetes patients through monthly outreach activities, diabetes self-management and support classes, nutrition and medication management programs. 77% of our patients have type 2 diabetes, 21% have prediabetes, and 2% have type 1 diabetes. 68% of our patients have high blood pressure, and 41% have high cholesterol. 80% of our patients are overweight, and 50% of our patients are obese. Additionally, VITCO continues to raise awareness and reach underserved communities. VITCO services includes our mobile health initiative, where we go into the community and conduct diabetes screenings to identify new cases of diabetes and people with uncontrolled diabetes. We recently purchased a mobile unit to increase access to these types of services and conducted a diabetes screening event at the Flamboyant Garden Independent Living Community on April 11th. To further increase accessibility, we have purchased an ADA-compliant 6-passenger van to transport our patients to their appointments. For the first time in decades, our pediatric endocrinologist is seeing children with type 1 diabetes, helping to address a long-standing gap in care, and has seen over 30 children ages 4 to 18. I am happy to report that VITCO is partnering with the Department of Education to launch its Childhood Diabetes Prevention Program. VITCO will conduct diabetes screenings for children in the 4th and 5th grades on May 8th at the Eulalie R. Rivera K-8 school on St. Croix. Children identified with diabetes will participate in interactive education on preventing diabetes through healthy eating, physical activity, and lifestyle choices. Parents will be encouraged to schedule an appointment with our pediatric endocrinologist for diagnosis and next steps. I would like to thank Mary Moorhead and the Commissioner of Education, Dionne Wells Hedrington, and her team for their support. We're partnering with Howard University and Freestyle Libre to provide continuous glucose monitors, or CGMs, at no cost to our patients, and we'll use those monitors to help manage the care of our patients over a 12-month period. This program will roll out in the summer. In recognition of the National Diabetes Awareness Month, we partnered with the University Center of Excellence in Developmental Disabilities to launch 8 public service announcements to promote diabetes education and prevention. Our partnerships are expanding. VITCO receives referrals from the Department of Health, our federally qualified health centers, local hospitals, Cleveland Clinic, and local private providers. I would like to thank the 34th and the 35th Legislature for including VITCO in the miscellaneous budget and for supporting our work. We're expanding our footprint in the community with outreach, education, and awareness activities. Over the past 12 months, we have conducted and/or participated in over 50 outreach events. Our efforts also include launching a CDC-approved Prevent Type 2 Diabetes program, a year-long initiative designed to delay or prevent the onset of type 2 diabetes. Most recently, we conducted a cooking class in partnership with UVI's School of Agriculture Cooperative Extension Services Community Nutrition Program on St. Croix on April 3rd and on St. Thomas on April 10th. We have grocery store walkthroughs scheduled for April 17th on St. Thomas and April 24th on St. Croix. Our monthly diabetes medication management and nutrition classes are held virtually from 12 to 1 p.m. The next nutrition class is scheduled for April 24th. Among our recent innovations is our remote patient monitoring initiative, which has already yielded promising results. As of September 2024, 80% of patients with uncontrolled diabetes have seen improvements in their A1C levels. Notably, 21% of patients showed a marked reduction in their A1C, and those with A1C levels greater than 7 experienced reductions ranging from 10% to 40%. At the August 2024 Diabetes Health Fair on St. Thomas, we had over 100 people waiting for eye exams. Of the 39 patients screened, 16 patients required further evaluation with an ophthalmologist. And of the 16 patients who required further evaluation, 8 had referable diabetes retinopathy. Of the 8 patients with referable diabetes retinopathy, 5 had vision-threatening diabetic retinopathy. These results underscore the value of these types of initiatives. Senators, our patients are the heart of our mission. With their permission, I would like to share some improvement our patients have made in reducing their A1Cs. And by way of background, I just wanted to remind you that diabetes is diagnosed through a hemoglobin A1C test, a fasting plasma glucose test, and/or an oral glucose tolerance test. And a normal A1C is less than 5.7%. You are within the pre-diabetic range if you have an A1C of 5.7% to 6.4%, and you have diabetes if you have an A1C greater than 6.5%. So in the St. Croix district, Mrs. Andrea Du Bois reduced her A1C from 6.2 to 6.0 and lost over 20 pounds. Ms. Pascaline Jacobs lowered her A1C from 10.2% to 7.2%. And Mr. Gregory Douglas improved his A1C from 8.5% to 5.8%. In the St. Thomas district, Mr. Arvin Joseph reduced his A1C from 12.6% to 6.9%. Mrs. Sheila Welch lowered her A1C from 6.4% to 5.7%. And Mr. Michael Daniel improved his A1C from 7.6% to 6.4%. These are just a few examples of the real-life impact our programs have had. Improved health outcomes for our patients will lead to reduced hospital costs, decreased long-term medical costs, reduced disability, and increased workforce productivity and prevention savings from early interventions. Other innovations and expansions include the over 580 people participating in our diabetes-related educational programming. We obtained our CDC Prevention Center recognition. As I mentioned earlier, we partnered with Howard University to provide endocrinology services. We're now providing providing diabetic retinopathy screening with our partnership with Dr. Liu. We partnered with United Healthcare on health and wellness initiatives, partnered with the Division of Personnel on health and health promotion activities for all GVI employees, conducted a very successful diabetes health fair on August 24th at the UVI 13D Innovation Center on St. Thomas, where over 200 people received rapid A1Cs, had visits with diabetes specialists, got their feet and eyes examined, and participated in nutrition classes. We purchased 2 retinal imaging cameras, 1 in each district, and we invested in telemedicine infrastructure and upgraded our electronic health records to participate in the territory's health information exchange. We also collaborated with Amazon Web Services to enhance our data infrastructure. In line with our sustainability goals, VIDCO has made significant strides in securing funding through billing for services and obtaining 4 new grants. To continue this life-saving work, we're respectfully requesting $1.5 million in funding to sustain our current operations and expand critical services such as pediatric endocrinology care, podiatry, community outreach programs in the St. Thomas and St. John districts. 50% of these funds will be allocated for direct patient care, 43% will cover preventive programs, and 7% will support administrative and operational costs. Ongoing support is critical, particularly as 63% of our patients are uninsured, underinsured, Medicaid, and Medicare recipients. VIDCO's preventive work helps reduce government healthcare spending and increase access to diabetes-related services for vulnerable populations. When you consider the patient costs of managing diabetes at $10,000 to $15,000 a year versus $80,000 to $100,000 per month for a dialysis treatment, VIDCO's services is a worthy investment. VIDCO is already demonstrating a return on investment. With this funding, we can expand our diabetes mobile health services, reach more people with diabetes, continue to target children and adolescents with early interventions, and improve the quality of life for people living with diabetes. Without this continued support, we risk losing momentum on the tremendous progress made in prevention, treatment, and education. Access to essential diabetes care for thousands of Virgin Islanders, especially seniors, children, and low-income families, will be significantly compromised. VIDCO represents hope and healing for thousands of Virgin Islanders battling diabetes. With your continued support, we can turn the tide on this epidemic and build a healthier, stronger territory. Senators, VIDCO is on a path to becoming a regional leader in diabetes care. We are expanding our reach to the British Virgin Islands, where we are co-hosting a diabetes health and wellness fair in November. This cross-border collaboration exemplifies the broader impact VIDCO can have across the Caribbean. We are unique in our holistic, patient-centered model of care that combines medical treatment, education, behavior change, and community engagement, aligning with the U.S. Department of Health and Human Services Healthy People 2030 objectives. And in closing, VIDCO represents not just a clinic, but a community solution to one of the most pressing public health challenges in the Virgin Islands. Together, we can make diabetes preventable, manageable, and no longer life-threatening in our territory. We are ready to partner, expand, and deliver. Thank you for your continued support, and I'd like to close with this video.
Media, you could run the video, please.
Absolutely wonderful. I really appreciate that they opened this up today to give us an opportunity to go to the different stations. I went to endocrinology, which was awesome.
This is a good event because those that don't have the insurance, basically it gives them the opportunity to come in and make sure that they're very healthy as well.
This was a great event, man. I mean, honestly, a lot of people came out. I was surprised at the turnout. People came and they asked me a lot of good medication questions. I was able to get some people to switch some meds, etc., or even go back to their doctor and switch some consulting. So it was a good event.
This is for an event where we can get the community screened for their blood sugar, their blood A1C. You have a podiatrist here, Sheen, that's checking your eyes, nutrition, counseling, all of the skills, all of the expertise that you need to properly treat and manage your diabetes is right down here. This is so exciting that we have the opportunity to help co-sponsor such major health screening event for our community. We continue to do our best to serve the people of the Virgin Islands, to improve their health care, and to try to live longer and healthier lives.
This is an awesome event. I feel really proud of this accomplishment that we're able to come and bring these services to the community. Thank you to the community for everybody who has supported. Please come again. We will be doing this regularly.
And Senator, I did want to mention that Dr. Nuni Bland will have to drop off at 1 o'clock. So if there are any questions for her, being the diabetes specialist and the endocrinologist, please, if we could ask her those questions before she has to leave.
Very well, thank you very much, Dr. Sheen, for that excellent presentation. And it's all about paying it forward. I mean, I think that what we're seeing here, especially after a discussion like yesterday, where my colleagues and I, had to deal with the funding crisis that's our hospital and health service experience, and this is so fitting. And certainly, I commend the work that's been done by VITCO. And I know your presence today is you have an ask, and I heard it at the last paragraph, the $1.5 million, but it's paying it forward. I mean, we see where individuals that's uninsured and underinsured continue to be the ones that's really going to our hospitals and our healthcare facilities for uncompensated care that we end up paying a lot of money for. And of course, uncompensated care accounts for those individuals that, again, don't have insurance, underinsured, and there is no remuneration from anyone except maybe the government of the Virgin Islands for the care that goes to these individuals. So those with the chronic illnesses, those with the gunshot, those are emergency situations that end up at a hospital, those are the ones that account for our uncompensated care in this community. I wanted to ask you before I open up the floor to my colleagues for maybe a 3-minute round I hear that you're branching off to the BVIs, but we have more than enough work here in the Virgin Islands. We got to get this under control before we go anyplace else, So I want to make sure, But what are you seeing in terms of some of the diagnosis? I know that obviously uncontrolled diabetes leads to renal failure. It leads to amputation. It leads to all of these other issues. How is the public education ongoing in regards to helping us to understand what's happening in our life, the way we eat, the way we season our food, the way we're consuming, the amount we're consuming, the need for exercise, control our alcohol intake, exercise regularly. How are you having that public education with our community to help us to impact what we're seeing with these numbers going down?
So we worked with the UVI Center of Excellence in Developmental Disability to develop, I think it was 8 public service announcements, and they were exceptional. We focused on everything from how to read food labels. Mrs. Shamira Robinson did a PSA on that. We run those ads on the government access channel, WTJX, cable ran them for free. We have them on our website, on our Facebook page. We boosted those ads. We did a lot. Dr. Aber Roberts did something on diabetic foot care, which is really one of the complications. It is an exceptional PSA because it really talks about the do's and don'ts in just taking care of your feet. Dr. Nuli Bland did a PSA on knowing your numbers, not just your A1C, but we find, I talked about the fact that 68% of our patients have high blood pressure and 41% of them have high cholesterol. So what we're seeing is we're not just managing diabetes, but we're managing sort of the ABCs. You can't do one without the other. So we do a lot of education, and we do education on a monthly basis. It's very important because the World Health Organization indicates that 80% of your health care is your lifestyle and 20% is clinical. So that means that we have to do a lot more in terms of education, and we offer those educational offerings right now free of charge.
Okay, thank you. And I like where you also have partnered with the Department of Education. That's a targeted area of a population that needs to be addressed in terms of getting into our school. So I commend Mary Moorhead as well as the Commissioner Deanne Wells Hendrington to really creating that partnership, because that's where you could start to impact and change lives in the education sphere. I wanted to ask Dr. Bland real quickly. I know that you're in the DC area. Are you seeing, or what are you seeing in your community, similar or different, in terms of West Ham in DC?
Yes, our numbers are very similar to the Virgin Islands in certain populations in the Washington, D.C. area. And particularly, we actually treat a number of those individuals by educating them in terms of the importance of knowing your numbers, your A1C, knowing what your blood pressure is, knowing what your cholesterol, and providing them the education, the diabetes education. We have Dr. Evans, who is our PharmD. She provides the medication management for our patients. And we have seen similar results, as Dr. Sheen had noted, that the reduction in their A1Cs, their blood pressure, their cholesterol. And we're proud to say that for those who participate in our program here in Washington, D.C., that they do not go to the hospital. They are not in the emergency room. And so they can always contact us. And I think that's very important in terms of making sure they get their medication. And more importantly, in terms of prevention, the prediabetes, making sure that they understand what good nutrition is, the exercise, and it's so important that our lifestyles can significantly impact our overall health.
Okay, thank you. Thank you for that. And I see that we've been joined by Senator Clifford Joseph as well, Clifford Joseph Sr., that is, as well as Senator Kurt Vieira. Good afternoon, Senators. Thank you for joining us. As well as DeGraff, I didn't recognize you before, as well as Senator DeGraff, I'm sorry. Senator DeGraff has been here for some time now. So one last question before I open up the floor in respect to, is the risk factors high blood pressure or high cholesterol weighs heavier in either side? Is it the same as it leads to the diabetes and some of the illnesses that we see? Is any of those risk factors any different, any lesser punitive to your body? Dr. Bland?
No, I think, very similar. In terms of weight, obesity contributes a lot to health disparities that we see. And that's one of the underlying causes that leads to particularly type 2 diabetes. And so with prevention of obesity, with the diet and exercise, is extremely important that we can actually control our blood pressure, control our elevated cholesterol, prevent things like diabetes. And so this is something that we really to emphasize to our patient population. I don't think it's anything that is significantly different between the people that we serve in Washington, D.C. and those in the Virgin Islands. Very common in terms of the types of food that you eat, the portion sizes, the amount of fat and sugar that we have in our diet, the sugary drinks, the highly processed foods. And this is something that we need to educate our population that these foods are not good, that we need to eat more vegetables, green leafy vegetables, eliminate those highly processed foods, chips, cookies, cakes, and so forth. So this is something that I really try to emphasize to patients, how important diet is. And, we have a nutritionist on the call, and she can really, expound upon this.
Thank you. At this time, I'll open up the floor for questions. Yes, I have given up my Snicker bar at night for Apple. It's been hard, but it's a work in progress. Senator Fonseca, you recognize for your 3 minutes at this time.
Thank you so kindly, Mr. Chair.
Oh, you sit there. You're still in session mode. You're still in session mode.
Thank you so kindly, Mr. Chair, and welcome to Dr. Sheen and all of the good folks of the whole posse, the VIDCO posse. Colleagues, diabetes is the leading cause of kidney failure. It leads to blindness and amputations and many other major illnesses. And the Health, Hospitals and Human Services Committee, we've received testimony from the Honorable Commissioner of Health, Dr. Encarnacion. She supports the initiative of Dr. Sheen, the Executive Director of VIDCO. Diabetes is out of control in the Virgin Islands. This funding to VIDCO will help the currently around 14,000 persons. We received the testimony today in our community with pre-diabetes and full-blown diabetes. And kidney disease is the fastest growing non-contagious disease in America. And people of color has a greater risk of kidney failure. 9 out of 10 people with kidney disease are unaware they have it. And half of them with severely reduced kidney function, even though they're not yet on dialysis, do not know they have kidney disease. Dr. Sheen and I have worked on this funding request with the governor, his chief of staff, Kevin Williams, and the OMB director, Julio Reimer. And we have been able to secure this $1.5 million. So we have a petition. We've developed a petition, and it's going to be circling around. Dr. Sheen and I have developed a petition. We're going to get those 14,000 residents to sign it. And the ask is only $1.5 million to allow the Virgin Islands Center for Diabetic Excellence to keep its doors open. Right now, without this funding, Dr. Sheen is going to have to close her doors. We need this funding now. They're in the Royal Leicester Snyder Hospital, and they're also located at number 44 La Grande Princess in Christian said St. Croix. That's right, they're in both islands. So this petition is asking for $1.5 million. All kind of important services they provide. They have a podiatrist, she's right here. They have an endocrinologist, she's on the teams. You get your blood sugar, your A1C test. You hear what they say? The magic number is less than 5.7. If you're 5.7 to 6.4, then you're borderline. Anything more than 6.4, you're diabetic. Right now, if I ask for the people right in this room to show a hand who have diabetics, several persons going to raise their hand. We have Miss Tintin right here, So we've heard the testimony. Committee members, we're asking for $1.5 million. And this, like the chairman have said, this will also reduce the uncompensated care. It will reduce the emergency room wait time. It will reduce the numbers, and it will save lives. And saving lives is the most important mission of this legislature. And I thank you so much, colleagues, for your favorable consideration, and have a blessed day. Sorry, I'll ask some questions later, but I wanted to ask one question on the chair's time, if I may.
You may.
Yes. What is your percentage of the persons you treat that are uninsured and that are on Medicare?
Let me find that number. So, 1 second. So Medicaid is 18.8%, Medicare is 43.5%, and people with no insurance is 5.9%.
So see that about 68% of her patients are on the lower pay or no pay. That's why we need to help them. Thank you, Mr. Chair, for the time.
Thank you very much, Senator Fonseca. Next, we'll recognize Senator Franklin D. Johnson. You're recognized for your 3 minutes.
Good morning. Thank you very much, Mr. Chair. Good morning to my colleagues. Good morning to the testifiers. Good morning to the viewing and listening audience. I first want to say I appreciate all the work that VitaCare is doing. I thank you guys for all your effort. But I was listening to your testimony. One of the questions I want to ask you, how connected you guys are with human service? And my reason for asking this question is the first of the month, you go in the grocery store, you see everybody that get these welfare check, buying nothing but sweets and everything that these children shouldn't be eating. It's not healthy for them. How connected you are with human service to start doing some kind of classes for these families who are underprivileged but not spending and buying the things that they should be buying to make sure that these children have a chance. How connected you are with them?
That's a really good question. The only connection we have right now is with the Medicaid program, which comes under Department of Human Services. And in addition to that, we send our flyers regarding our nutrition classes that we offer free of charge to the community right now on a monthly basis to the Department of Human Services so that they can send it out to everybody within their schools, whether is people on welfare or on those social support programs, on Medicaid, to participate in these classes. And I don't know how far that goes, but what you're talking about is something that I'm very passionate about, and we need to have some policy changes with the WIC program in the Department of Health, with the Department of Human Services, so that, and I don't know because they receive federal funds, how much flexibility they have to really direct their participants to purchase certain types of foods, but it's certainly a conversation that we need to have.
Yeah, I definitely know that that's a conversation that needs to be had and like, no, because you just, and I try not to go into the store the first of the month because it's chaos in there. But if you do go in there and you see the shopping cart, there's more junk food in those carts and the sweets and you just name it. So I know that our children are not getting the best meal, most of them I would say, and that's a high risk of them going down this road. You spoke about 50 events. In those events, is there any way you could tally to find out
1 minute
how much of those folks that are on welfare or receiving stamps are partaking in these events? Is there any kind of analysis you can look at and say, well, you know, we have this amount of people. Is there any way you could do that in your analysis when you're having these events, trying to teach folks how to shop, how to eat right?
Well, we definitely can add a question to our survey. We do have an assessment form we use for all of our screenings and educational outings. We can add that question to it. But whenever we have our health fair, we have nutrition classes that run every 15 minutes. So people learn how to read food labels. They learn about carbohydrates, starchy foods, etc.
And I think I got just a few seconds here, but I want to ask this question. And like I said, I appreciate what you're doing. I'm not on the finance committee, so I don't have a vote here today. But I understand all the needs that you guys want. But my question is, what is your long-term plan for financial stability, especially with 63% of the folks that are either uninsured or underinsured? So what kind of long-term plan do you guys have?
So it includes not only coming to this body and asking for this supplement, but we are aggressively writing grants. We just wrote a rural health grant just recently. We're getting ready to respond to a grant that's due next week. So we're very aggressive at writing grants. In addition to that, we are billing for our services. And then we are going to be launching an annual campaign where we have several fundraising activities during the year to raise funds to address uncompensated care and support the additional services we provide to uninsured, underinsured individuals.
Thank you very much. And again, thank you very much for the work that you guys are doing to inform this community of diabetes and all different health cares that associate with it. I every day you see somebody new that's lost their sight, lost a limb. It's serious, and we need to try to really address it and get the word out a little bit more. I can't say I hear a lot of ads in related to it, and that might be a different direction we need to try and go, doing more ads on the radio shows them and different places like that so that we can make folks more aware. And I'm quite sure some of them are aware, but really are not really measuring out the consequence of what their life will be if they don't change their style of eating. Thank you very much, Mr. Chair.
Thank you very much, Senator Johnson, for your line of questions. And before we go to Senator Frederick, which will be the next senator up, I wanted to ask you, Dr. Sheen, are you approaching the philanthropic groups or even the Coca-Colas of the world? I think CC1 is what they go by now. Are you having discussion with them in respect to their contribution to this education as well as funding requirements?
Yes, so far we've met with Bloomberg Foundation, Benny Benjamin Foundation. We actually submitted a proposal to Bloomberg, to both organizations actually, and we're waiting to hear back. But we are reaching out to definitely philanthropic organizations, as well as we're cultivating our donorship. So we're doing that and approaching individuals in our community that could potentially become a donor for the organization.
Excellent. Senator Frederick, Hubert Fredericks, you're recognized for your 3 minutes.
Thank you, Mr. Chair. Good afternoon, my beloved Virgin Islanders. My colleagues, good day. Central staff and my staff, good day. Dr. Sheen, thank you so much for the opportunity to share your beautiful organization with us. I had the privilege, along with the Health and Human Hospital Chair, to tour your facility while they were still under renovation, and I had a great time. I happen to know a few of the patients there as well, so I'm a big supporter of this program. Also being the former Deputy Commissioner of Health that dealt with health promotion and disease prevention, I could tell you this program is essential for our community. It's so unfortunate that we are not sharing this information with more people, because this is what we need: prevention. Prevention is going to help save us a whole lot of money. And unfortunately, we're not getting the word out as much as we'd like to. Dr. Sheen, what's your penetration with social media at this point? Where are we looking like?
So we have analytics that we do collect. I don't have that information before me right now, but we do have a social media presence. That's how we promote a lot of our events, and the outcomes have been very positive in terms of people showing up for our events, etc. We are building the momentum, and people are learning more about us. And I think once we move to the Saint-Fan Shopping Plaza, for example, on St. Croix, it is very much more accessible than where we are, because where we are, you have to climb the stairs. And we'll be right there on the roadside, so you'll be able to see the office from the road. So we are making a mark in terms of a social media presence, and I do have the analytics. I just don't have them with me today.
So in your testimony, page 2, you talked about obesity accounting for 80% of the diabetic cases that we see. What's your relationship with the Department of Human Services and with the SNAP program in particular? What are we doing to see if we could find a way to penetrate those applicants who receive SNAP benefits to see how we could get them to not only, eat better, but to buy better foods.
So the only relationship we have with the Department of Human Services is through their Medicaid program. And then, of course, we've shared our educational offerings with them so that they could share it to their SNAP beneficiaries. Not many of them participate. I'm not sure if the information is getting out there, but certainly we need to circle back with the Department of Education to make sure that we have maybe a formal MOU in place and some commitment on their behalf to at least share the information. We also need to explore if the policy or the regulations that governs those programs allows them to even make any changes, allows them to make any changes in terms of what they require them to purchase with their monthly supplement. So those are things we need, conversations that we need to have.
So I think we have some leakage on the media, if you would, please.
Mute.
Mr. Chair, can you hold my time for a second?
Yeah, media, please hold Senator Frederick time. If we could ask those individuals that's online, please mute your phone when you're not speaking. It's bleeding through. You may continue, Senator.
Thank you, Mr. Chair. In reference, Dr. Sheen, in reference to remote monitoring, how much of an impact is that having in terms of the levels of cases you see right now?
So I had included some outcomes in my presentation where I had mentioned that 80% of our patients with uncontrolled diabetes have seen improvements in their A1Cs, and that 21% of patients showed a marked reduction in their A1C, and those with A1Cs levels greater than 7 experienced reductions ranging from 10% to 40%. And we expect to see greater outcomes. We saw overall with our patient population
30
that
seconds.
80% of our patients are reducing their A1Cs. And so the remote patient monitoring devices that you saw when you visited us, we're getting ready to add the continuous glucose monitors to that. That's the small little devices that people wear on their arms. We're going to be offering that through a grant free of charge to our patients that require it, and then we're going to be managing them over a 12-month period. So we find that the continuous glucose monitors and remote patient.
I have to cut you off there because I don't have much time and I need to get these questions in real quick. Sorry, Dr. Sheen. But in terms of your current operating costs, where we stand right now, what's your current operating costs for the facility?
So that's what I'm requesting, the 1.5. It's actually $1,587,000. That's our current operating. That in order to provide. Pardon?
That's only for your lease obligation at Sign Farm?
No, that's the operational costs to provide services territory-wide to even include St. John.
Time.
Mr. Chair, can I complete this thought, please?
You may, Senator.
Thank you very much. So, Dr. Sheen, that's your total overall cost, 1.5 for the entire operation in the U.S. Virgin Islands. What your expansion to the BVI will be impacted how financially?
So I'm so glad you asked that question, because our expansion to the BVI has nothing to do with our financial operations. They are paying for us to come there to provide services. We're not incurring any expenses on our behalf.
And one other last question, in terms of the shortfall, is this shortfall between federal funding and currently what you anticipate your expenses to be that you're trying to get the 1.5?
No, the 1.5 is what we're trying to get, so that is the overall operational cost for the organization.
And so how much do you currently have?
Right now, we have about $500,000 in federal funds, but a part of that is our ARPA funding, which pays for a lot of the services that we provide, and we have roughly about $200,000 in ARPA funding left.
Thank you very much, Mr. Steer. I appreciate the line of questioning. Thank you, Dr. Sheen.
Thank you very much, Senator Frederick. At this time, I want to recognize the presence of Senator Maurice James. Good afternoon, Senator. Thank you for joining. She is a committee member as well. A point of information, Senator Fonseca.
Yes, thank you, Mr. Chair. Dr. Roberts, the podiatrist, you know, sometimes our people, we have a cultural thing. You know, my brother being passed away, but he was an orthopedic surgeon. I remember one patient had came to him, and she was saying that an ant had bite on her foot. But by the time she was seen, she had full-blown diabetes in her foot. So can you give us some of the things that you can look for with your feet so that you can, come to you?
Certainly. So with
Name and
yes,
title.
I'm Dr. Ava Roberts, podiatrist with Virgin Islands Diabetes Center of Education. Of Excellence. Good afternoon, everybody. Good afternoon, Senator, and everyone present in person and those online as well. Thank you for the question, Senator. So in terms of, foot and foot issues, prevention is the best treatment for any diabetic complication. Some of the things that we look for in these patients, redness, wounds, open sores, rash, dry skin, thick nails, ingrown nails, all of those things can lead to complications in our diabetic population. We tell our patients, we educate our patients, there are a list of do's and don'ts that you should do as a diabetic patient. You should not, the do's include you have to check your feet every day, look for any open sores, any dryness, any thing that looks unusual, because any slight break in the skin can lead to an infection. It can lead to, major complications, and an infection can lead to amputation and even loss of life for these patients. Some of the other things that we try to educate our patients, do not, soak your feet. A lot of these patients have neuropathy. Neuropathy is a loss of sensation, and these patients would not even know that they stepped on a needle or stepped on something sharp, and it could go into their foot and cause infection. And if they have neuropathy, they can't really feel until everything blows up, which might have been the case for you, Senator. Mm-hmm.
Well, Sir Popa, well said. Thank you, Dr. Roberts. Thank you for the time, Mr. Chair.
Thank you very much, Senator Fonseca. Next, the chair will recognize Senator Blyden, and he'll be followed by Senator Graff. Senator Blyden, you're recognized for your 3 minutes.
Thank you so much, Mr. Chair. Good afternoon to my colleagues, viewer and listening audiences, staff, central staff. Good afternoon, Dr. Sheen and Dr. Roberts, and thank you so much for your testimony and your advocacy and the work you do on a daily basis. I know in the 34th and 35th, we did give you funding for the miscellaneous section, like many other non-for-profit organizations that does great work here. And we know things are very tight. So Mr. Health Hospital and Human Services Chair, you'll be a great advocate in terms of advocacy work and getting the word out. I'm serious. You have done a great job in that respect. Let me state though, because like I said, there are many non-for-profit organizations that does great work. I even got a call today from another non-for-profit that does great work that still have not been paid their funds to do the great work in terms of filling the gap here in the territory. But nonetheless, I appreciate everything you're doing.
Thank you.
Moving forward. Let me ask you though, in terms of educating the public, and I know you said you have already gone to the schools. I think a couple other places that you need to go that would assist you with your work in the housing communities.
Yes.
And churches.
Yes.
Those are the great places where there's a lot of people, and a lot of those individuals need the assistance and the education in terms of healthy eating, exercise, etc. I think that's the next place that you can tap into. Let me ask you though, because I found it curious in your testimony on page 3. You spoke to the grocery store walkthrough. that's scheduled for April the 17th on St. Thomas and the 24th on St. Croix. What the goal, what the mission, what the purpose of the walkthrough with the store?
So it's really just teaching people how to read food labels, teaching them how to select healthy choices, because we go shopping and a lot of people don't know what they should be putting into their carts. So that's really the main purpose of that.
That's very good. I appreciate that, because I know also when licensing and consumer affair was in front of us a couple of weeks ago, I spoke about that also in respect to expiration of food, you know, the food in terms of spoilage, etc. So that's important that they can look for those things at that time also. That's important. But let me also ask one other quick question in respect to your testimony. You say you're seeing children with type 1 diabetes, and that has increased tremendously, and you are providing care and education to those individuals. What do you believe is the cause of that, because in terms of that increase when it comes to our children?
Well, you know, I talked about going into the schools and screening children in the 4th and 5th grade, but a big cause of type 1 diabetes is just genetics. You know, having a family history of diabetes, that's one piece. And then, of course, for those children that have type 2 diabetes, it's really about their eating habits. Many of our children are overweight and obese. That's a major challenge. And so we're going to be screening children in the 4th and 5th grade, as well as children with a family history of diabetes and those that are overweight and obese.
Briefly, what's the difference between type 1 and type 2 diabetes, so folks can know the difference?
Good question. So type 1 diabetes is called autoimmune. It's an autoimmune disorder, and 5% of the population has type 1 diabetes. It's most common among children and adolescents. Type 2 diabetes is considered insulin resistant, and you can get that just by being overweight and obese as well. So, and most people in the world, even here in the Virgin Islands, have type 2 diabetes.
And how important is it for our children, especially our children, to have exercise in terms of helping to assist in not getting there?
Yeah, so I think exercise and eating healthy are the two vital, two main ways of preventing diabetes, not just for children, but for adults as well.
But I think we have done a little part in respect to exercises. We appropriated some funds from the Epstein Fund for all of the different housing communities to assure that the playground equipment are repaired and basketball courts, etc. Because if you go to the housing communities, the kids aren't really doing anything.
30
so
seconds.
I think that will go a far way in terms of assisting with those kids, making sure they do what they do when they go on the playground and have fun and at the same time get exercise.
I think that's a good idea, but I think we need to go a little step further because we need to do some education for the parents, because even with the renovations of these playgrounds, a lot of children are inside on their phone watching TV. True. So how do you know? You have to make sure that the parents understand that they need to get outside, take those phones away from them. So that is going to be really important. Otherwise, you won't see people or children on the playground.
I agree, and that's why I said that most of them, they are gone. So we're trying to put them back. So I appreciate the work you do, and thank you so much for your testimony and your work. Thank you so much, Mr. Chair, for the time.
Thank you very much, Vice Chair Senator Blyden, for your line of questions. Next, the Chair will recognize Senator Dwayne DeGraff. You recognize for your 3 minutes.
Thank you, Mr. Chair. Good afternoon, colleagues, testifiers, all of you listening and present. Do you have any link with Little League, baseball, basketball, tournaments, and different things? Maybe if you do some tournaments, you might get to some of these children.
Thank you.
We do not
have those relationships. Thank you.
Because, you know, I like sugar. I like McDonald's. You know, I like all the bad things. How do you get me off of what alternatives do you put out to someone who is locked in like that? And I'm open to change, but some people aren't. So how do you reach them?
I would like the registered dietitian, Shamira, if you could respond to that.
Absolutely. Good afternoon again, everyone. My name is Shamira Robinson, registered dietitian. I think that's a very real question. And I think that's where a lot of people are. It's like, these are the things I know, these are the things I like. Why and how do I do any differently? And I think we approach that issue from a lot of different avenues. So the biggest thing is education. When you don't realize how much certain foods are impacting your body or impacting your blood sugar and your blood pressure, you're more likely to do them because you just don't know how important it is. So through our nutrition classes, our monthly nutrition classes, we really break down, okay, if you eat that hamburger or cheeseburger, if you eat those fries, if you have that Snickers bar, this is exactly what happens to your blood sugar. And sometimes that's enough for people to make those changes. In other cases, is people aren't as familiar with what other options are out there. And that's where things like the grocery store tours come into play, because sometimes it's not enough just to know what you could do differently. You have to see, okay, if I'm in a rush, I'm in the grocery store, I usually pick up the same 10 things. Here are some other things I could easily swap out if I need to. And I think the last component is just about taste, because sometimes we just like those foods because they're good. And so through the cooking classes, as Dr. Sheen mentioned, that's a way to get people trying different foods and get familiar with different foods to say, okay, I know I typically like this thing, but now I'm open to a healthier option. I realize that healthier foods can taste good and they're good for me. And that is motivation for people, helping people to make some of those changes that you talked about.
Okay, the great answer. And I think, like I say, because I know there are millions of people like me, so just want to make sure that we could get the word out. Now, okay, this body has given you money before. We have no bill here today. You're asking for $1.5 million just in a conversation. I hint to you, when you come, get with a senator to create a bill so we could give you the money. We ain't going to give you the money, you come and testify alone. So we got to work on it. You have the bill? Okay, we can't see that. I ready to give them money. But I'm just saying, now, okay, why do we have to give you 1.5? How long have you been in existence?
We've been around since October 2020.
Right, so from 2020 to now, we giving you $1.5 million for operations.
You haven't given us $1.5 million.
No, but I'm saying this you ask now. So we're going to give you $1.5 million for operation. How many employees do you have?
We have 6 full-time employees, and everybody else are contractors.
And how do your employees who are on there make a living in terms of if you need this 1.5 for operation?
Yes, so we've included the salaries of all our employees in that $1.5 million. We've also included things like benefits that none of us have, health insurance, retirement plan. We don't have any of those things. So the $1.5 million would include those benefits for us as well.
Okay, because then then other nonprofits going to say then you need to start looking for more money different ways, because $1.5 million, when that $1.5 million ends, what happens to your employees? What happens to your organization?
That's a good question. Well, certainly a part of our sustainability plan isn't just coming and making this type of requests, but we have been very aggressive in writing grants, in billing for our services, in fundraising, et cetera. So we have a sustainability plan.
So through the chair, can I get a copy of the sustainability plan?
Sure.
So we could see that, so we could know that if we are going in this venture, that you're going to be able to stand on your own 2 feet after. Now, GLP-1s. Everybody, all these commercials, you're seeing them, they're talking about, people losing weight, the A1C, and all of this. Now, GLP-1s are new in the system. Have you seen, or are they good to take for persons who
30 seconds.
Overweight, obese, who may have the diabetes? And are they good direction to go in?
We have our pharmacists on the line, Dr. Ebony Evans, so you can answer that question.
Hi. Oh, sorry.
Time.
Sorry, I just had to switch from computer to phone. Could you repeat that question?
I've seen the advertisements on TV, GLP-1s, Wegovy, and the different things.
Yeah.
This is new, medications and stuff. It seems to be working wonders for people. Is this a good direction to go in when it comes to addressing diabetes overall?
Yeah, absolutely. So all those medications in that class, so like Trulicity, Wegovy, Ozempic, those are all called GLP-1 agonists, and they have a lot of really good benefits. So just first and foremost, they're good for diabetes strictly in terms of reducing blood sugar levels. So that's, of course, important. But they also work in the gut, so they help to promote satiety, which is essentially the feeling of fullness. So they help to reduce appetite, which also helps to lead to weight loss. And we know that obesity is one of the biggest contributors to insulin resistance. So that has a double effect in also helping to control blood sugar levels even more. But we also find that in recent trials, these medications have been shown to be cardioprotective, meaning they reduce the risk of heart attack, stroke, any type of cardiovascular disease. But they've also been shown to be renal protective, meaning that they've also been shown to reduce the risk of chronic kidney disease or the progression of kidney disease in people that have already kind of started showing those signs. So yeah, to answer the question, great medication class, very beneficial for reducing blood sugars, promoting weight loss, preventing any kind of cardiovascular disease, as well as slowing kidney disease as well.
Thank you. One final question, Mr. Chair. And in closing, I thank you for that information. Very, very good. Now I understand a lot more. In closing, the government health insurance has employees, couple thousand retirees, couple thousand. Do you have any type of collaboration? Because they're doing different things. They're walking, nutritional, this for seniors and stuff. Are you in any collaboration with them in regards to population, reaching out to the entire population?
Yes, we do have a relationship with the government employees program, health and wellness program. Okay. We actually present at their annual conference. And then every time we have our monthly diabetes medication management classes, as well as the nutrition classes, they send our flyers to all GVI employees and people that participate in those programs. Okay. So we do have that relationship.
So Dr. Sheen, to you and your team, thank you very much.
Thank
I highly
you.
appreciate it. Thank you, Mr. Chair.
Thank you very much, Senator DeGraff. Next, the chair will recognize Senator Clifford Joseph Sr. You're recognized for your 3 minutes. And he'll be followed by Senator Kurt Veely.
Good afternoon to the listening public. Good afternoon to my colleagues. Good afternoon, Dr. Sheen.
Good afternoon.
How many patients have you attend to without insurance?
We have seen, 1 second, find it. .9% of our patients have no insurance.
And how do you recover from whatever you use to take care of these patients, to address these patients?
So the patients that come with no health insurance, they usually pay out of pocket, which is very expensive. So that means that they don't get to come as often as they need to come because they're paying out of pocket. Another thing, and I'd like to publicly thank Dr. Nunli Bland for her graciousness, because she knows about all of the discount programs for medications. She goes online and she researches and prints out coupons for the patients so that they can get a discount on their medication. A lot of times those coupons don't apply, although it says it applies to the United States and the territories. A lot of the pharmacists don't honor it. So we have a lot of challenges where people don't have access, not just to getting the services they need, the medical services they need on a regular basis, but then we're trying to come up with solutions to help them where medication is concerned. I had one patient mention that, she has to choose between paying her light bill or purchasing her medication. So it's really a challenge for our patients.
Okay, but still, do you go ahead and serve them, or?
We do. We don't turn anybody away. Yeah, we don't turn. Yes.
And presently, do you have a contract or anything with BOC, with the Department of Bureau of Correction?
We do not. But that's a good idea.
So you never entered BOC to
We have not. We have not established a relationship with them, but I do think that that's a good idea.
Okay, good. Because I know we do have patients that will be diabetic as well within the Bureau of Corrections.
That's correct.
Well, thank you for your answers and thank you for the service that you're doing at this time. And again, I'm a non-committee member as well, so I'll be listening up. Thank you, Mr. Chair.
Thank you.
Thank you very much, Senator Joseph. Before we go on to Senator Viale for his line of questions, one of the discussions that we have had with the Cigna representatives is the issue of individuals not taking advantage of some of the preventative programs that we do have in place. They're not seeing their primary care physicians, they're doing a follow-up. Some of these individuals, and while we have spent $161 million in Cigna cost claims, we're seeing where a lot of this is really the catastrophic, and we still have a great number of the population that don't access, that healthcare spectrum. Mm-hmm. Do you see that as an area to be targeted? I mean, without violating HIPAA and those type of things, how do you start to reach out to those individuals that may not be seeking, those primary care physicians, advising? Because the bad part about that, and one of the things that I've been strongly advocating for, was for them to have the mobile substations, which you have now, to go out into, to meet the patients where they're at, go into these various agencies, and be able to do biometrics and those things. And every single time they go out to these areas, they find themselves with first-time diagnoses that drive these people. They have to call the ambulance in some instances for those individuals. How do you see that as an opportunity to be able to start to target some of those individuals?
It is an opportunity for us. We launched our Diabetes Mobile Health Initiative, and we're actually reached out to all government agencies and some private agencies as well for us to go in, use our mobile van to go in and provide services. That's one way of reaching them. We also reached out to Housing Authority to go into all of the housing communities to provide services. And then I think what we've established here in the territory is our signature event, and that is our Diabetes Health and Wellness Fair, which is very successful. People actually, they meet me in the street, it's like, when are you gonna have another fair? And we reach a lot of people who don't have primary care providers, who have never been diagnosed with diabetes. These free events, we can only afford to do it once a year, but it's so critical because it's the one time that some people that don't believe in going to the doctor, that don't have health insurance, would actually come out and get vital services. And what's unique about our signature event is that we go beyond just your basic screening. And so those are ways that we are reaching out.
Good. I encourage and implore you to continue along that track. At this time, the chair will recognize Senator Kurt Viale. You're recognized for your 3 minutes.
Thank you. Thank you, Mr. Chair. Good morning. Good afternoon to the people of the Virgin Islands. Good afternoon, colleagues. Good afternoon to the testifiers.
Good afternoon.
I know at the end of, first let me congratulate you guys for the work that you're doing on a regular basis. So congratulations on that.
Thank you.
Initiative is really good. But let's get directly to the funding. You are requesting $1.5 million from the legislature. And that $1.5 million, you have it broken down? How much for salaries, et cetera? Can you give me the breakdown?
I do. I did send that information to Senator Francis, but I can definitely pull it up if I can find it.
Okay, while you're pulling it up, you said you have 6 employees. And how many contract employees?
I will have to get you that number, sir. And the contract employees are primarily our providers, but I can get you the exact numbers. Let me just find the...
Okay, and in terms, you spoke about fringe benefits and insurance. You trying to partner with the government insurance, private insurance?
Yes, we've already submitted an application to them so that we can be covered.
Yes, to which part? Yes, to which part?
Yes, to the fact that we've submitted a letter to the Government Insurance Board to ask that we be included in the government insurance program.
Okay, so are you considered a semi-autonomous government entity, or how are you?
We are
how are you
considered
linked?
a 501c3 nonprofit organization, but there is a law on the books, and I can't quote it off the top of my head, that allows nonprofits to be included in that, the government insurance plan, if 75% of their funding comes from either local and or federal funds.
Dr. Sheen, allow the senator to complete his thought with his question before
I'm
we
sorry.
respond to you.
I'm
Cut him
sorry.
off.
I thought I would.
Go ahead, Senator.
Okay, and then in terms of the retirement, what type of system are you looking at?
We were looking at partnering with a Marshall and Sterling, not a Marshall and Sterling, Charles Schwab.
Okay. And you said that you received some grants. How much grants did you receive, and what's the amount?
We received 4 grants, a total of $1.9 million.
These grants from where? Can you name the source?
The sources are a combination of ARPA funds, HRSA, Health Resources and Services Administration, U.S. Department of Education, and then, of course, we received supplemental funding from the miscellaneous budget.
So you received 100,000 in the miscellaneous. I'm saying.
Yes.
How much did you receive? How much did you receive in ARPA funding?
1.9 million.
So you had 1.9 alone in ARPA. So that means that your grant amount is more than 1.9 because you said you had 4 grants. But
Yes,
I know the one grant
yes.
that
I'll have to get you
was
the breakdown on
given by the
all the
executive
grants.
branch. I know that the one grant that was given by the executive branch was 1.9 million.
One
I was
minute.
trying to find other grants.
Yes, I'll have to get you that number for the other grants, especially the HRSA grant. That one was $995,000, but that one wasn't for operations. That one was
Okay.
for medical equipment. Then there's the USDA grant, that's $185,000. You have your miscellaneous funds, that's $200,000, and then the ARPA would be 1.9 million.
What's your operating expense per year?
My operating expense per year is the 1.51. It's actually 1,587,287 cents.
Is all the monies from the other grants have already been expended?
No, most of it has.
Okay, and the reason why I'm asking you the question is your request is 1.5.
Correct.
And the 1.5 is for operating expense for 1 year. But once you put something in place, you got to keep in mind that that is what you're going to have to fund on a regular basis unless you're able to offset it with federal grants. So if 1.5 is put in now for you to be able to hire and operate the clinic, then we're saying that that is a 1.5 appropriation that you're expecting every fiscal year?
That is what I'm requesting. Yes, Senator.
Okay. And I'm looking at the context of funding that the legislature provide. We do provide funding for federally qualified health centers. And we presently provide funding to Predicate Health Center, I think at the cost of some $3 million, that has a tremendous amount of employees and a tremendous amount of services. So just to try to equate the operation of the 2 different entities and the fact that you're also now billing, I'm trying to work out the figures mathematically as to what the legislature would be able to do. So in context of Predicate Health Center that received
30
some $3 million, and you're saying that you have 6 full-time, are you planning to ramp up a bit?
Yes, we do, especially because we do want to serve the territory. We're currently on St. Thomas. We would like to expand to St. John.
And that is if money is available.
That's correct, sir.
Thank you, Mr. Chair.
Thank you very much, Senator Viale, for your line of questions. Next, we'll recognize Senator Maurice James. You're recognized for your 3 minutes.
Thank you, Mr. Chair. Good afternoon, Virgin Islands, everyone in and outside the room. Good afternoon, Dr. Sheen, and congratulations on what you've done so far with the Virgin Islands Diabetes Center of Excellence.
Thank you.
When did you begin operations?
October 2020.
October of 2020.
Yes.
And I am curious, prior to 2020, where were most people with diabetes served in the territory?
They were served. Go ahead.
Go ahead.
So they were served in hospitals, served by primary care providers. We have one endocrinologist. We had one endocrinologist in the territory. So they were served in different places.
When you started, did you have any data on the amount of people who were identified as having diabetes prior to your start? I mean, there must have been a reason why you felt a need to create this center, correct?
Yes, there is a need for it, but I didn't have, what I do have is just prevalence data from years ago. For example, the prevalence rate for diabetes now is about 16.9%. 3 years ago, it was like 14%. So every year it has increased.
Oh, well, that's not good.
Yes, it is not.
Right? Not good. You invested in a health van, right, to transport patients to appointments. Is that a service only for the people who are your patients?
1 minute.
You're talking about them to your facility, correct?
So it's not just for our patients. We see patients that are not necessarily our patients, and that's where we do a lot of outreach. So we reach anybody. You don't necessarily have to become a patient of ours, but we want to provide services whether you're our patient or not. But what we do want is we want to see more coordination. And that's where we've established relationships like with the health center, for example, so that we're referring patients back and forth. And now that we're going to be on the same electronic health record, we can actually do referrals electronically and share notes electronically. That's, I think, is important for us.
Okay, I wanted to go down that path, but I actually have some other questions I want to quickly ask. How many of your providers are actually on island?
We have one main provider or two providers. Our nurse practitioners are the ones that are on island. And then you have our endocrinologists and podiatrists as well as ophthalmologists that come back and forth. They come once every 2 months, they come once every 3 months, but they provide telemedicine services like our endocrinologist provides telemedicine services on a regular basis. But then she's going to be here, for example, at the end of this month.
Yeah, I wanted to ask about the telehealth services, if that is something that's provided every day from your center.
Yes, we use telemedicine extensively. When we're not doing telemedicine, then we're providing in person. Like our endocrinologist will be here the end of April. And she'll be here providing services on St. Croix and on St. Thomas.
Time.
How many full-time on St. Croix and how many full-time on St. Thomas?
We have one full-time nurse practitioner on St. Croix, one full-time on the St. Thomas, and we have a medical assistant on St. Croix and a medical assistant on St. Thomas, and that's clinical staff.
Mr. Chair, just one more question, if I may. I think I heard my time.
You may, Senator, you may continue.
Okay. Regarding the Department of Education, did you get a grant from the Department of Education to assist with the program that you're seeking to launch, the childhood diabetes?
No, we didn't get a grant.
Program?
We didn't get a grant, but it is something that the Benny Benjamin Foundation expressed interest in funding.
So they're funding that program?
Well, we submitted the proposal. We're waiting to hear back, but it is something, when we met with them, they said that they were interested in that.
Okay. I just wanted to say with respect to programs and any type of events or whatever that we're having where we are serving people, there is always a cost, and sometimes people forget that. So even though it's wonderful to talk about programs, there's always a cost associated with it. And so I was really just interested in how you were going to fund that particular program.
So I wanted to mention and just provide clarification on that. While we wait for the Benny Benjamin Foundation to fund that particular initiative, there are two ways that we're funding that program. Number one, we are billing the parents' insurance. And for those children that don't have health insurance, there is a waiver that's being provided through the Medicaid program to pick up the cost for the children that need to be screened. And that's how we're funding that particular initiative. But then again,
Okay.
that's only paying for the supplies. I just want you to know that. Yeah.
Okay, thank you. Thank you, Mr. Chair.
Thank you very much, Senator James, for your line of questions. I think that rounds out all of the senators thus far on this. I wanted to ask you, have you approached Cigna or Human Services about a level of partnership, again, for education, public education purposes, as well as the services that you provide? Because in all of the preventative mode, it helps to reduce what we've seen on the back end of this. Have you approached any of them in terms of perhaps partnering with some funding?
I approached Department of Human Services Medicaid program to provide funding so that we could implement sort of a managed care program for Medicaid members, because our Medicaid members are some of the sickest individuals that we serve, right? And then haven't approached the Cigna, but we did approach United Healthcare. So that's something we still need to do.
Okay. What about telehealth? What does telehealth look for BITCO?
So when we have our open house, you'll have an opportunity, all the senators will be invited to have an opportunity to see what we're doing to integrate technology into everything that we do. And telehealth for us is we're using a telemedicine cart to provide telemedicine services, where the provider could be in Washington, D.C., for example, or at Johns Hopkins University, and they will have the consultation with the patient, but the patient comes into the office to see the provider.
Okay. And I'd like to ask you, Dr. Roberts, as you have an audience there, or we do have a large audience that actually watch our Legit TV. Here's an opportunity for you to be able to talk to those individuals in terms of wound care and wound management. You know, what is it that you like to tell them in respect to what they may be experiencing with a particular wound that's taking a long time to heal? You know, what's happening within their body framework that again may be leading to some other catastrophic illness before it gets to that gangrene status. You know, what would you advise a person that may be experiencing some difficulties right now with an open wound that's taken a long time to heal?
Well, thank you, Mr. Chair. So wounds is definitely a road to really bad complication, amputation, and even death. Wounds need expert care. Diabetic patients who have open wounds really need to be under the care of a podiatrist or foot care specialist. Wounds, it is, as a podiatrist, it's very, very important for us to heal wounds as quickly as possible. The longer a wound stays open, these wounds are subject to infection, non-healing, and just really bad complications. Infection going down to bone, and the need for amputation. So I would really strongly encourage anyone out there with wounds on their feet to be seen by a podiatrist or wound care specialist as soon as possible. We have a lot of different interventions that can help to heal wounds right away, such as skin grafts. We need to really evaluate these wounds for infection, get patients on antibiotics. We really need to offload the foot in different areas if this is the cause for the wound. we also need to assess their blood flow because oftentimes wounds with lack of blood flow will not heal. So patients really need to be seen by a podiatrist or wound care specialist as soon as possible.
Thank you for that. I thought that that would be important for the public to hear because, of
Thank
course,
you.
wounds contribute a lot to that. So, Dr. Sheen, what is your overall, at least what was your spent in 2024 in terms of your overall operating costs?
What we spent?
Yeah.
I would have to get you those numbers.
Okay.
I would have to get you those numbers. But to Senator Vele's question, if I may respond, we have 6 in this budget. We have 6 full-time employees and 14 contractors.
14 contractors. Okay. And then you'll share with us. You said you sent forward the budget breakdown for.
Yes.
Yes. So
I sent it to you.
Yes, we'll share that. Okay. All right. I'll give you a minute.
Mr. Chair.
Yes, Senator Vele, you recognize.
Thank you so much. Can you break down the 14 contracted position
Yes.
and also the 6 position and the costs? You have a cost for them? You have a cost now that you could provide?
I have a cost that I can share. I don't have it broken down by the separation between contractors and employees, so I can revise the budget to do that and then send it back through the chair if you'd like.
Go ahead and tell me what the total cost is for those 2 groups.
Okay, so
the contract,
right, so
regular.
Okay, so the employees are $370,000, and the contractors, or at least the providers are $696,800, and then the what we call the patient education outreach, that's how I have it set up, is $192,800. And then French benefits would be $99,221.15.
And in terms of your billing, I know you've been billing for a while now. Well, what's your receivables with billing?
Right, so we've only been billing for a full year. Because when we started providing these services, they were just supported through the grant, and there was no billing. So for the full year, our receivables have been in the area of like $70,000.
What's your goal?
My goal is $350,000.
Okay, and if you could provide through the chair the payer mix for that $70,000, is it mostly Medicaid, or are you getting a lot of patients with insurance?
Correct. The payer mix is majority Medicare and Medicaid, and you know that the reimbursement rate for Medicare and Medicaid is the same and it's lower than the private insurances. And then Medicaid, we're owed like over $10,000.
Okay. And you have a billing company as a contractor?
Yes, we do.
Thank you, Mr. Chair.
Thank you very much, Senator Vele. Dr. Sheen, I'll give you a minute to close off with this. Huh?
Yes, I really would like to thank all of you, the senators of the 36th legislature, for the opportunity to present here today. And I'd like to thank our patients that joined us in person on St. Croix and on St. Thomas, our Vice Chair, Donna Christensen, who's on St. Croix. Just thank everyone, the community, for all of your support. I'm usually stopped and people compliment us. Thank you for your kind words. But I'd like to remind you that we are ready to partner to expand and deliver our services to the people of the Virgin Islands. And have a blessed day.
Thank you very much. At this time, the Committee of Budget, Appropriations and Finance will stand in recess for 3 minutes. And when we come back, we'll be merging block 2 and 3 and move on with this agenda. The Committee of Budget, Appropriations and Finance stands in recess for 3 minutes. And we are out of recess again. Today we're in the Committee of Budget, Appropriation and Finance, and we just wrapped up block number 1, and now we are about to merge block 2 and 3. Madam Clerk, please call up the items in block 2 and 3.
Block 2. Bill number 360062, an act approving the lease agreement between the government of the Virgin Islands, acting through the Commissioner of the Department of Property and Procurement, and the United States Department of Commerce, National Oceanic and Atmospheric Administration for a portion of the telecommunications tower located on parcel R22 of Tract 1, Estate Nazareth, number 1, Red Hook Quarter, St. Thomas, sponsored by Senator Milton E. Potter by request of the governor. Invited testifier, Mr. Vincent Richards, Assistant Commissioner, VI Department of Property and Procurement. Bill number 36-008, an act amending Title 33 Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset a property owner's property tax liability against any amount of money that the government of the Virgin Islands owes to the property owner, sponsored by Senator Milton E. Potter. Invited testifier, Mr. Brent Leerdam, Tax Collector, Office of the Lieutenant Governor. Bill number 36-0042, an act amending Title 33, Virgin Islands Code, Subtitle 3, Chapter 118, Section 3411, to increase the maximum judgment amount for the award of damages against the government of the Virgin Islands, sponsored by Senator Alma Francis Heiliger. Invited testifier, Dr. Felicita Richards, League of Women Voters. This ends the reading of today's agenda, Mr. Chair.
Thank you very much, Madam Clerk. We do have all of the invited testifiers seated at the testifiers table. We'll go quickly to recognize them, and then we'll have the bill sponsor speak in each of the measures before us this afternoon. We'll start off, Ms. Richards, Dr. Richards.
Good afternoon. Dr. Felicita Saldana Richards, representing the League of Women Voters.
Okay.
Testifying on behalf of the League of Women Voters for the President of the League of Women Voters, Dr. Gwen Molinar.
Thank you. Assistant Commissioner.
Good afternoon, Vincent Richards, Assistant Commissioner of the Department of Property and Procurement.
Good afternoon, Clarina Modeus Elliott, Executive Assistant Commissioner, Department of Finance.
Good afternoon, Julio Reimer, Director of Office of Management and Budget.
Good afternoon.
Good afternoon, Brent Leerdam, Tax Collector, Office of the Lieutenant Governor.
Thank you.
Good afternoon, Ludens Romney, Tax Assessor, Office of the Lieutenant Governor.
Thank you. And we go quickly to St. Croix. Ms. Moorhead.
Good afternoon, Shalma Moorhead, Assistant Assessor, Office of Lieutenant Governor.
Cool. Thank you. Thank you very much. Who speaks to bill number 36-0062?
I do, Mr. Chair.
You recognize Senator Potter. Senator President Potter, you recognize for presentation on bill number 36-0062.
Thank you very much, Mr. Chair. This bill is fairly straightforward. It is a lease agreement between the United States Department of Commerce, National Oceanic and Atmospheric Administration, who will use the premises for the purpose of transmission and reception of weather broadcast communications and emergency broadcast communications, which is contingent on the lessee obtaining and maintaining the required permits, licensing, and any required rezonings of the premises to a zoning designation compatible to the operation of same as required by law. I am asking for support on behalf of Governor for this very straightforward bill. As you all know, we stand to be beneficiaries of this bill, given our geographic location and just the realities of living in the Caribbean, where hurricanes and unpredictable weather is always a major reality. So at the appropriate time, I'm asking the members of this committee, I am not a member of this committee, to support this bill. Thank you very much, Mr. Chair.
Thank you very much, Senate President Potter, for presentation of Bill number 36-0062. Real quickly, before we go to Mr. Vincent Richards to put his testimony on record, I'd like to recognize the presence of non-committee member, Senator Alma Francis Hiley. Good afternoon, Senator. Welcome. Assistant Commissioner Richards, you recognize for your testimony on Bill number 36-0062 at this time.
Good morning, Committee Chair Novelli Francis Jr., Vice Chair Marvin E. Blyden, committee members, the Honorables Kurt A. Vielle, Dwayne M. DeGraff, Ray Fonseca, Hubert L. Frederick, and Maurice C. James, non-committee members, central and legislative staff, fellow testifiers, visitors present in the chamber, and members of the viewing and listening audience. I am Vincent Richards, Assistant Commissioner of the Virgin Islands Department of Property and Procurement. I am testifying today on behalf of the Commissioner, Lisa M. Alejandro, to offer testimony on the proposed lease agreement before this committee for consideration. Today, the Department of Property and Procurement requests this committee's and ultimately the full Senate's approval of the proposed lease agreement between the Government of the Virgin Islands and the United States Department of Commerce, the National Oceanic and Atmospheric Administration, thereafter NOAA. The lease agreement requires legislative approval in accordance with 31 Virgin Islands Code, subchapter 205. The term commences on the first day of the month following the approval of the legislature of the Virgin Islands. The United States government agrees to promptly consider and adjudicate any claims which may arise out of the use of the premises by the U.S. government, duly authorized representatives or contractors of the U.S. government, and pay for any damage or injury as may be required by applicable law. The lease agreement between the Government of the Virgin Islands and NOAA is for a portion of the telecommunication tower located on parcel R-22 of Tract 1, Estate Nazareth, number 1, Red Hook Quarter, St. Thomas, United States Virgin Islands, with the geographic coordinates of latitude 1819.42.5, longitude 645133, hereafter referred to as the premises. The term of the lease agreement is for 20 years. The annual rent of $1,200.00 will be payable at a rate of $100 per month without demand thereafter. NOAA covenants and agrees to pay said rent as for said. In the term of the lease agreement, if the term of the lease agreement includes any partial month rent for the partial month shall be prorated, nor shall use the premises for the purposes of transmission and reception of weather broadcast communications and emergency broadcast communications. As the lessee, NOAA is responsible for obtaining and maintaining all required permits, licenses, and any required rezoning or zoning designation compatible to the operations on the premises. For the purpose of this lease agreement, the United States government is self-insured. Therefore, no insurance was provided or is required. The proposed lease agreement will assist NOAA and the government of the Virgin Islands in collecting atmospheric data within the United States Virgin Islands on the islands of St. Thomas and St. John, as well as on St. Croix, provided the United States Virgin Islands with an optimum weather broadcast and emergency broadcast systems, keeping them informed and prepared for the never-ending environmental changes affecting the area. The Department of Property and Procurement and Commissioner Alejandro respectfully requests that the Committee on Budget, Appropriations and Finance vote in favor of the proposed lease agreement. This completes my testimony. I'm prepared to answer any questions the committee may have regarding the proposed lease agreement. Thank you very much, Mr. Chair, and the rest of the committee.
Thank you very much, Mr. Richards. I guess that rounds out the testimony on Bill 36-0062. Next, we'll go to the next bill, and who speaks to Bill number 36-0008. It's an act amending Title 33 Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset a property owner's property tax liability against any amount of money that the government of the Virgin Islands owes to the property owner. Who speaks to this bill?
I do, Mr. Chair.
Senate President Potter, you recognize for presentation on bill number 36-0008.
Thank you, Mr. Chair, colleagues. I ask for your support of this bill, bill number 36-0008. As you know, we all live here in the U.S. Virgin Islands. Residents of this territory has been facing its own share of economic pressures, exacerbated by natural disasters, of course, COVID pandemic, and ongoing fiscal constraints. Very often, this has led to, in many cases, to overdue property tax obligations. This bill requires the Lieutenant Governor to offset a property owner's tax liability against any property tax liability against any amount of retroactive monies that the government of the Virgin Islands owes to the property owner. What prompted this bill? A friend of mine whose mother lives on the island of St. John, an elderly St. Johnian, a homeowner, in 2021 was in jeopardy of losing her property because she failed to pay approximately $15,000 in property taxes. Now, bear in mind that this person is also owed over $30,000 by the government of the Virgin Islands, a legitimate obligation as a public sector employee. She was owed over $30,000, and she was in jeopardy of losing her property because she owes the government $15,000 in retro. Doesn't seem fair, doesn't seem just. This bill simply allows for the homeowner to offset her property tax liability based on the existing obligation for retroactive wages. And for sure, I know we haven't paid retro in a while. I mean, we did yesterday. But it is a legitimate obligation of the government. It is on the government's books. And this is an opportunity for the government of the Virgin Islands to reduce its obligations, to take that obligation from off of the books while giving property owner an opportunity to make good on their property tax obligation. I think it's a win-win. Had an opportunity to speak to the personnel from the Lieutenant Governor's office. We had a very, very good meeting. Property tax collector, Mr. Leerdam and his team, Mr. Romney, and they expressed some concern, I guess, about the far-reaching implications of this measure. So in response to that, we provided an amendment. We circulated the amendment to all members of the Committee on Budget and Finance, and we're limiting it to just retroactive obligations offsetting property tax obligations. So we've narrowed the focus of the bill. I think it's fair. I think it's just. We also adjusted to not incentivize property owners to just not pay their taxes currently, because I know the Lieutenant Governor's office and the government of the Virgin Islands looks forward to these critical revenues. We decided to apply the bill really goes back to the older property tax obligations. So from 2020 and backwards, heading backwards. So it does not incentivize them to just delay from paying, and it allows the property owners to live in a level of dignity to satisfy their property tax obligations while reducing the government's liability that is on the books that the auditors tell us every year you have to do something about this, carrying this over $100 and something million in property taxes from off the government's books. So I see this as really an opportunity for a win-win. Like I said yesterday, we paid out $22.5 million. That's how legitimate this obligation is. Suppose we had this bill passed and we had the opportunity to utilize that $22.5 million for something else. It's a legitimate obligation. I think this is a creative way for us to reduce it. It's not unprecedented. Entities throughout the United States do it. I don't expect the tax collector to say, hooray, I don't, to agree. Because his job is to collect the taxes and as much as he can, but I think just just looking from a position of reason, I think this is something that it's not going to break the government. As a matter of fact, it's going to be a win-win for both sides. At the appropriate time, I am asking you, colleagues, as I am not a member of this committee, I'm asking you for your support of this legislation. Thank you very much, Mr. Chair.
Thank you very much, Senate President Potter. Next, we'll come to the Lieutenant Governor's office. Mr. Leerdam, you're recognized for your testimony at this time.
Thank you, Mr. Chairman. Good afternoon, Chairman Novell E. Francis, Jr., all other members of the Committee on Budget, Appropriations and Finance of the 36th Legislature of the Virgin Islands, all other senators present, and the listening and viewing audience. On behalf of the Honorable Lieutenant Governor Tregenza A. Roach, Esquire, I am Brent Leerdam, Tax Collector of the Division of Real Property Tax, Office of the Lieutenant Governor. I'm accompanied today here in chambers by Mr. Ludens Romney, the Tax Assessor, and in the St. Croix chambers by Ms. Shalma Moorhead, Assistant Tax Assessor, also of the Division of Real Property Tax within the Office of the Lieutenant Governor. Mr. Chairman, I'm here today to provide testimony on Bill number 36-0008, an act amending Title 33 Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset a property owner's property tax liability against any amount of money that the government of the Virgin Islands owes to the property owner. Specifically, Bill number 36-0008 amends Section 2494 of Title 33 of the Virgin Islands Code by adding subsection B to state in pertinent part that, upon application by the taxpayer and certification of proof of debt, the Lieutenant Governor shall credit or offset the property tax liability against the full amount that the government of the Virgin Islands owes to the taxpayer. Proof of debt is defined as a certified judgment or order, including a consent judgment entered in favor of the taxpayer in civil litigation, a settlement agreement, or any other evidence of the government's indebtedness to the taxpayer accepted by the Lieutenant Governor. Upon reading Bill number 36-0008, the credit or offset proposed in this bill implies that actual money or revenue would not be coming into the coffers of the Office of the Lieutenant Governor, and by extension, the government of the Virgin Islands. For example, based on our understanding of the bill, if a taxpayer receives a judgment in amount of $200,000 from a court or a government department or agency, or any of its instrumentalities or semi-autonomous agencies, and a taxpayer owes $100,000 in real property tax arrearages, then $100,000 would be credited to the taxpayer's account in the Office of the Lieutenant Governor to offset the real property tax owed, in effect, zeroing out all property tax arrearages. Please note that the Office of the Lieutenant Governor, Division of Real Property Tax, is not in favor of this bill. Moreover, it is our position that the offset allowed under this bill does not directly address the issue facing this government in the administration of its fiscal responsibilities, which is that there is a shortfall in overall revenue collection in the territory, due in large part to inflation and the rising cost of living. While we acknowledge that the constraints resulting from this shortfall in making payments on debts owed by the government may be the impetus for the drafting of this bill, we believe that the focus at this time should remain on the enhancement of revenue collections. Notwithstanding, we have conducted a thorough review of this bill and have had discussions regarding its potential impact on the division and, by extension, the government of the Virgin Islands. Based on this review, the Office of the Lieutenant Governor, Division of Real Property Tax, offers the following in support of its decision not to support this proposed legislation. First, because under Section B3 of the legislation, the definition of proof of debt is so broad to include any other evidence of the government's indebtedness to the taxpayer accepted by the Lieutenant Governor. This language allows any individual or entity owed a debt by the government to apply for an offset of the debt. Therefore, we ask you to consider that a debt could include a debt owed by this government in retroactive wages to several unions in this territory. Such costs could be exorbitant and place an undue burden on the collection of real property taxes and the reliance of the government thereon in generating revenue and providing services. Further, there are currently debts owed by the government of the Virgin Islands to companies that are vendors and contractors for services they provide to this government. These debts can also be exorbitant. If real property taxes owed is used to offset these debts, this could result in a huge reduction in revenue generated by this government, which would adversely affect services provided by the government. Second, because of the offset allowed under this bill will reduce LGO's projected and highly anticipated revenue received from the collection of real property taxes, the government's heavy reliance on these projections in the administration of its fiscal obligations would also be adversely affected. This is significant because there are certain periods during the fiscal year when there is a reduction in other revenues, such as those derived from income and gross receipt taxes, when real property taxes are relied upon for payment of expenditures to fulfill obligations such as payroll and payment to vendors during the affected period. Third, as it pertains to LGO and the Division of Real Property Tax, a reduction in the amount of real property taxes collected would also adversely affect the amount of money in the Office of the Tax Assessor's Revolving Fund, utilized for the benefit of that division for expenditures such as compensation to the vendor for the real property tax management system and customer online portal, as well as for training and certifications for the members of the division staff. Please note that the cost of such services can be very expensive and it is expected to increase. By statute, the fund is subsidized by 1% of the revenue collected in real property taxes. Fourth, for LGO to accommodate the changes necessary to implement the requirements of this bill to zero out debts owed to the government, the existing real property tax management system would have to be modified, which means that there will be an additional cost to LGO for the modifications. Currently, the features needed to accommodate the offset are not available in the property tax management system. As you may be aware, the costs for contractual services have increased enormously, and the Office of the Tax Assessor's Revolving Fund mentioned above is unable to accommodate this cost. Therefore, an appropriation would be needed to to effectuate any modifications to the current system. Fifth, having such a credit-debit function without the generation of financial receipts is a function that the Real Property Tax Division has recently and purposefully abandoned with the adoption of the new property tax management system. If the Division of Real Property Tax retains credits beyond the amount due in property taxes, then the tax parcel owner should accrue interest until such credits are applied. Further, a property tax management accounting ledger is not appropriate for holding, transferring, applying credits, and will cause larger issues affecting the integrity of our newly acquired property tax management accounting system. Sixth, because of the intergovernmental agency collaboration between agencies with disparate technology systems, which agency will assume ultimate responsibility for the accuracy of the credit/debit process? This process will seemingly be fraught with auditor questions, and one agency will not hold all the answers. The process may cause the integrity of Government of the Virgin Islands financial audits to be called into question. Last but not least, in light of the matters addressed in this testimony, we recommend that if the Office of Management and Budget, as well as the Department of Finance, has not yet been invited to provide input regarding the impact of this bill, they should be so invited in order to provide a complete and thorough overview of the overall impact that the implementation of the requirements of this bill will have on the revenue generated by the Government of the Virgin Islands and the ability of the government to fulfill its obligations. For the reasons stated in this testimony, LGO is not in favor of Bill number 36-0008. Mr. Chairman, thank you for the opportunity to testify in this measure. We are available to answer any questions that you or members of the committee may have.
Thank you very much, Mr. Leerdam. The tax collector. Mr. Julio Reimer, you have anything to add to that? You're just here to support, as well as Department of Finance. You're just here to support as well. No additional testimony, correct? Okay. Okay, so that rounds out that bill number 36-0008. At this time, we go to bill number 36-0042, an act amending Title 33 Virgin Islands Code, Subtitle 3. Chapter 118, Section 3411, to increase the maximum judgment amount for the award of damages against the Government of the Virgin Islands. And who speaks to this bill?
I do.
Senator Alma Francis Heidegger, you recognized for presentation on bill number 36-0042.
Thank you. Good afternoon to my colleagues. Good afternoon to the people of the territory. Good afternoon to the testifiers and staff. Bill 36-0042 is a piece of legislation that I felt is time to be adjusted. For over about 40 years, it has been set at $25,000. As we have moved forward, $25,000 does not have the same value it did almost 40 years ago versus what the value is now. You have to stop and understand that when something is done wrong to someone else by our government, and you tell them that the only amount that they can get, no matter what happened to them, is a maximum of $25,000. You could run them over with a car, and they can't get more than $25,000. There could be an incident where somebody is shot, and they can't get more than $25,000. There could be an incident where somebody's house got accidentally burned down. And our maximum liability is $25,000 based on the laws of this land. And because somebody like me, I just want to make sure that if something is done wrong to someone, they're compensated, especially being a representative of the very people who this government is technically made up of. I still had to pause a little bit because I still have to be responsible, because running a government, you have to have balance. And when I was attempting to decide on a number, I initially wanted to bump it up to $250,000 40 years later. And I did some research looking at different states. Florida per person is $200,000. Colorado is $350,000. Idaho is $500,000. I could go down the list. Everybody has a cap. And some states have two caps where one is per person and one is per incident. The per incident is much higher because it might involve more people. So after speaking to several of my colleagues, the majority of them are willing to go around 150. In the spirit of compromise, a lot of times you have to, I might want something, but to make sure that the people of this territory get something, sometimes we have to make compromises. So I did submit it at the 150. And it is my hope that my colleagues today see and understand why this piece of legislation is being brought forward. And for me, two reasons. It's to help to compensate people that might need to be compensated when we as a government do something wrong. And it also, from my perspective, could assist us as a government to do better. Because if we know we're going to have to potentially pay out a maximum of 150 if something occurs, we might actually run this government better so we don't have to be in situations where we have to pay out. So I do hope that my compromise is acceptable to my colleagues, and I am looking forward to having a robust discussion about this, and I'm asking for your support today. Thank you very much, Mr. Chair.
Thank you very much, Senator Alma Francis Heiliger, and presentation of your bill. Next, we'll go to the League of Women Voters, Dr. Richards, for her testimony. You recognize Dr. Richards.
Dr. Felicita Richards, testifying on behalf of the League of Women Voters. Good day to the Honorable Novelle Francis and members of the Committee on Budget, Appropriations and Finance of the 36th Legislature, as well as the listening and viewing audience and other testifiers. I am Dr. Felicita Richards, a board member of the League of Women Voters, testifying on behalf of our president, Dr. Gwen Molinar, and the League of Women Voters of the Virgin Islands. The League of Women Voters of the Virgin Islands thanks the committee for the invitation to comment on Bill 36-0042, sponsored by the Honorable Senator Alma Francis Heiliger, which seeks to increase the maximum awards for damages against the government of the Virgin Islands. We regret the lateness of our submission, as the League had recently been involved in the planning, preparation, and implementation of our annual meeting, which has absorbed most of our time. We do thank the bill sponsor, Senator Alma Francis Heiliger, for personally responding to our questions regarding the bill. Specifically, we had asked, 1, the rationale for the increase, 2, whether surveys had been done with comparable jurisdictions. We were satisfied with her response regarding the rationale, which was that the current ceiling had been in effect for several decades. The League agrees with the Senator that the cost of living has certainly increased over the decades, and as such, can justify an increase in the ceiling for awards in damage suits. Further, Senator Francis Heiliger indicated in response to our second question that she did do a survey for comparison, which she believes justifies her proposal. The League regrets that we were unable to conduct our own review of award limits in comparable jurisdictions due to the time constraints explained above, and so the League cannot comment on what the ceiling should be. The League nonetheless supports the bill in proposing that the ceiling should be increased. Additionally, We do have some comments/questions for the committee's consideration as the bill is being deliberated. Specifically, the League asked, what is the source of the money used to pay awards for damages? If insurance, will its terms be adjusted accordingly? If not, should it not have such insurance? Number two, if it is believed that a higher ceiling for awards might serve as an incentive for more careful and better performance within government to avoid such suits, could it not be countered that the employees within government might reason that it is the government being sued, not them personally? In other words, we question the assumption that an increased ceiling would enhance more careful performance or service. Number three, are there some entities in government that should be protected separately? If the government does have insurance, we refer specifically to boards. Are they supported to the government's insurance if there is such insurance? In summary, the League is in full support of raising the ceiling, but we cannot speak to what the ceiling should be at this time. We would be happy to provide feedback on this latter point in the near future. Again, thank you for the opportunity to comment. And that comes from Dr. Gwen Marie Molinar, President of the League of Women Voters. I end my testimony.
And thank you very much, Dr. Saldana Richards, for your testimony on Bill 36-0042. Colleagues, that rounds out the discussion and testimony on the three bills before us as we merged Block 2 and 3. Which
Point of information.
Point of information, 1 second, Senator, which is Bill number 36-0062, Bill number 36-0008, and Bill number 36-0042. At this time, the chair recognizes Senator Kurt VLA for a point of information.
Thank you, Mr. Chair. In reference to 34-0042, is anyone from the government testifying on this bill, Department of Justice?
No, Senator. The only representative here for testimony on this bill is from the League of Women Voters.
Okay, thank you.
All right. Additionally, colleagues, there's a post-audit report on all three of the bills for your review as well. At this time, we'll open up the floor for questions, and I'll allow for a 6-minute round. Again, we have three bills before us, and I wanted to glean from Mr. Leerdam before we open up the floor. Mr. Leerdam, how is collections going at this time?
Collections, we're just coming out of what would historically be the slow months of collections. And so we're short of about 15% of our target. The collections generally picks up in late May, June, July, and August. And so we're relatively on schedule in comparative years prior.
Well, have you been able to do a financial analysis to determine the individuals that may qualify for retroactivity and maybe, again, prone to take advantage of this legislation and allow them to be able to offset?
Well,
what would the impact be to the Lieutenant Governor's office and the tax assessor's office?
Frankly, Senator, no, we haven't been able to because there's been questions about what exactly those proof of debt offsets would entail, and we did not receive a copy of the amendment mentioned. So, whether it would be income tax returns, whether it would be delinquent payroll that's due, So we really don't know what all it entails. But we do know, whatever it does entail, it would be of major impact to the revenues of the government because we rely on both current year tax collections, which is from the bill issuance in June until the end of August, as well as about 50% of our projections relies on delinquent tax collections that we have 2 specific tracks of collections on. So it would certainly impact us in a large way.
And the bill sponsor had indicated, based on presentation of the bill, that there is an amendment that again, put in some guardrails in respect to this being solely for retroactivity and from 2020 backwards.
Right.
What do you say to that?
We haven't had a chance to review said amendment, as well as, like I said, because it would be affecting delinquent taxes only, and we have approximately a 50% reliance on those delinquent taxes, it would still be of significant impact, but we haven't been able to do a detailed and specific study on it.
Okay. At this time, the chair will open up the floor for a line of questions from my colleagues, and for 6 minutes. And Senator Ray Fonseca, you're recognized for your 6 minutes.
Thank you, Mr. Chair, and pleasant good afternoon to all the testifiers. Quick question with bill number 36-0062. So if you're there by the Eudora Ken track and field, it's right on the hill above, that's where it is?
Vincent Richards for the Department of Property and Procurement. Yes, Senator.
Okay. So you're saying here you're going to utilize a portion of the telecommunications tower for this NOAA lease. What else is on that tower right now?
Senator, I want to believe that there's multiple antennas on the tower that belongs to different agencies of the VI government that supports emergency services and communication in general.
Okay, because once you mention that, it leads me down to Bordeaux, where they got that big dome there. They got a tower. That's the FAA, or that's no? Who's that leasing that one down in Bordeaux?
Senator, good question. The ones in Bordeaux, Estate Bordeaux, that those equipment are used by the FAA. And I believe in the previous legislature, we were here with a lease agreement in which the previous body approved leases for those properties.
Yeah, because, the people in Bordeaux, the cancer rate, we taught it. Just the other day, I went on there with my staff. We went to Botany Bay. Botany Bay, you can't get in. You got to show ID and thing, Yeah, that was the second time, actually, in my life I've actually been to Botany Bay. First time I went on there was maybe about 30 years ago. So now you're saying the necessary permits and zoning compliance. What kind of permits and zoning compliance is this?
Senator, I want to believe that zonings will be governed by the Department of Planning and Natural Resources. As far as other permits, I would believe that there's a federal agency that governs the use of certain frequencies and that manage that space.
Okay, because I got several more questions. So it's going to be for the reception of weather and emergency broadcast communication. So it's going to be able to track wind speed and pressure and location of storms. What kind of weather information you going to get from that tower?
Senator, to be honest with you, I'm not a subject matter expert when it comes to that kind of.
Okay. Well, it's good to know that the federal government is self-insured and they don't require any insurance. That's good because the way how things going now, we don't know. Okay, so it's no dangerous, frequencies and no high, dangerous radio waves and nothing to affect the residents in the area's health and etc. Right?
Senator, I'm not a subject matter expert on frequencies and radio waves, to be totally honest with you.
Okay, because when you tell me it's going to require necessary permits and zoning compliance, it leads me to believe it's not a regular tower. And if you're going to be receiving weather and emergency broadcast communications, it led me to feel that there's something going to be going on there that ain't mentioned. Because, we have down Bodo where that tower there, and the people them have claimed that tower there, has increased the incidence of cancer. As a matter of fact, Dr. Sheen was just here for the diabetes. And, we have the listing of diabetes in the whole of the St. Thomas district and the St. Croix district. And interestingly enough, Bodo is one of the highest incidence of diabetes, and you'd figure Bodo got all the fresh, fruits, and they got the sunshine and stuff, and the diabetes and the cancer is high down in Bodo. So I just want to make sure that the Nazareth residents ain't going to be suffering from any kind of illnesses for this new FAA tower.
So Senator, I want to believe that air pressure, wind speed, wind direction, I believe those are the data points that are being measured by the by NOAA.
Okay, and so then my last question for you. So Vitima, is this information going to be downloaded to Vitima so that Vitima would share that, or just the feds going to have this information?
Senator, I want to believe that every morning, every midday, and every evening when you get that weather report or when you get it popped up on your phone, that's where the data comes from these towers that basically measure these data points.
Okay, so that's a yes or no. So Vitima is going to be getting the information?
I can't speak to that fact, but I would assume yes, Senator. Yes, Senator.
Assume. I don't like that word too much. I just want to make sure that whatever is being installed out there in Eudora, because that's right up from the school. The kids are there, and we want to make sure that it's nothing dangerous, because I'm sure that there's other locations that the feds can select that's not in a neighborhood. Because I'm looking at the map here. I was just talking to the president about. We was looking at the map. They have a lot of homes in the area. They have a school in the area and everything. So I'm kind of concerned. Is there any other location, or why did they select that particular one? Is there something special about that tower? Why the Fed selected that tower?
Senator, I can't answer to the reason why that specific tower, but I can inform you that the equipment that they have, it's existing. It's been there before. It is there now.
There?
Yes, Senator, it is. It's been there.
Well, Sir Pupa, I gonna have to go look at that. I didn't know that they had that tower over there in Eudora, Ken.
30 seconds.
Okay, good. So thank you for that information. So I wanted to go quickly now to the bill here for the taxpayer. Excuse me, Bill 360008. So Mr. Brent Leerdam, sorry.
Brent.
Brent Leerdam. Yes, Barry is an employee at the legislature. Okay, so do you have a problem with the certified court judgment then? If the person gets a certified judgment from a court saying the government owes them that money, you're opposed to that being, countering the property tax debt? That's your position?
Well, the court being the final arbiter of any issues that may arise may have the jurisdiction to issue such a judgment, but we still stand in opposition because the impact to the government of the Virgin Islands would be great, because again, we rely on 50%, have like a 50% reliance on delinquent property taxes when we issue a projection. Our projection generally is broken down between the current tax time period, which again is from June to August, the end of August, and delinquent property tax collections is encompassing anything after that, inclusive of this period of time from 2020 and prior.
Okay, thank you very much, Mr. Chair. Thanks for the time.
Thank you very much, Senator Fonseca. Point of information, Senator Potter.
Mr. Chair, thank you very much, Mr. Chair. Just wanted to ask Mr. Leerdam, just the probability of collections. I know the older the tax obligations or the tax bills, the less probability of collection. Would that be fair to say, of collecting? So, you know, property tax obligations, let's say from 1980, 1990, and so forth. You have a less chance of collecting that versus, let's say, 2024, 2023. Would that be safe to say?
That's a fair general statement. Right. But as it pertains to property taxes, we have no statute of limitations on when we can collect it. And when we place a lien on a property and we move to final collection actions, that lien is more powerful than an IRS lien.
Correct.
And so we do move forward on it. And when we move something to final collection activities, however long that may take to reach to that point, we do collect on it.
Gotcha. My question really was, you mentioned that 50% of the revenues that you collect is from, I forgot the term that you use.
Is from delinquent property taxes.
Okay, what percentage of your collections is really derived from property tax obligations that's, let's say, 5, 10 years old? What percentage, if you were to drill down a little more rather than just the broad 50%, because it's delinquent when it's, you know, a day after the property tax due date.
Yes.
Right? So what percentage would you say you actually collect from taxes that are like 5 years, 10 years old?
Well, remember now, we're just in receipt of this amendment, and so without further review, I couldn't tell you that exactly, but what I can say is that if it's delinquent, it's delinquent, and we have no delineation between 5 years old versus 50 years old. And once we move to final collection activity, which is something that we don't enjoy doing, but the law dictates that we must do so, then we collect on it.
Right. I won't abuse my point of order. Thank you very much.
Thank you very much, Senator Potter. So, Mr. Leerdam, in instances where there is property delinquency, there is an opportunity for the Lieutenant Governor's office to auction those properties, correct?
Well, there's different tools that we have. There's real property tax auction sales. There's in-rem jurisdiction foreclosure, for which the final rules are being put together on that. And we also have tax lien sales.
In instances where the government may owe an individual's, be it retroactive or income tax return, is there any consideration for then that property owner in terms of these various options that you have available to them that the property will not be sold?
Well, at this current time, we have no way of knowing what the government may owe. So the considerations that we give is usually along the lines of, if it's in probate, we do not move it to final collection activity. If it is, if they have a payment plan that's in place, then we do not move it to final collection activity. But beyond that, we have no way of knowing what other instrumentalities may owe to that particular property owner.
So if the property owner brings you a document that shows from the Division of Personnel that in fact they're owed X number of thousands of dollars, is there any consideration given to that person?
Well, in fairness, we try and give consideration at every juncture. You know, so whatever we can find to make it more fairer, you know, we would likely consider that.
Okay. A good politician. That's not like a political answer, but I appreciate that. I think ultimately we're saying that there is a hardship or a level of fairness across the board that we're hoping to consider here. And even if you're saying that in terms of the offset, even if it's not done, then there should be some consideration that that person will not have the property sold consequential to monies owed to them as well.
Final collection activity is our absolute last option, and we try and do everything possible to avoid having a property go to that level.
Okay. At this time, we recognize, the chair will recognize, thank you for your response. The chair will recognize Senator Franklin Johnson. We recognize the presence of Senator Carla J. Joseph. Good afternoon, Senator. Thank you for joining us. Senator
very much.
Franklin Johnson, you're recognized for your 6 minutes.
Thank you very much, Mr. Chair. Good afternoon to my colleagues. Good afternoon to the testifiers. Good afternoon to the viewer and listening audience. I want to start off my line of question with property and procurement in regards to this lease agreement. How does the proposed $1,200 annual rent compare to other existing lease agreements with folks in the private sector or either with GVI? Because I know in some cases, families have put up towers on their property. So what's the comparison as far as the rate with other GVI property and private owners?
Vincent Richards for the Department of Property and Procurement. Good question, Senator. The lease, the amount that's being charged is very minimal. It's minimal on our scale. The federal government traditionally doesn't pay. It pays little to nothing, mostly nothing when it comes to these kind of lease agreements. I believe, for perspective, I believe in the previous legislature, we moved an agreement with the FAA, and that was a $0 amount lease agreement. Tower space is usually a premium for private sector renters on tower space, but consideration was given to the U.S. government for the amount that we charge, and that's why we charge a minimum on our scale. I hope that answers your question.
So are you saying to me that based on what you know, the people with private property get paid a whole lot more for space and towers, right?
To answer your question, yes, Senator, but this is not a tower. This is not a tower lease. The tower is existing. The tower is owned by the government of the Virgin Islands. The tower, they're just being allowed to rent a space on the tower to place some instruments to measure atmospheric data. So it's not leasing land. It's leasing space on a tower that's already existing, Senator.
Thank you very much. And then I'll move on to the next bill, which is bill number 36008. And my question will go to Office of Management and Budget. Have the Office of Management and Budget and the Department of Finance conduct any kind of physical impact assessment or provide feedback on how this measure, or this bill, I should say, of the government can create hardship or insolvency to the government?
No, Senator.
So you guys haven't done no kind of analysis? And I mean, you're here today, and this is what we want to hear. What is this going to do to us if we was to go down this direction?
So, Senator, you have a bill that has changed several times since I've seen it. So today it changed to just retroactive wages versus way before it was any and all sources of what the government would owe the individuals. Based on the conversations we've had, we spoke to the senator and basically informed him that he could not take tax refunds because it's a different class of tax. It's not possible because that's the federal versus local. That's one. Two, in terms of the impact, we have to look and actually go back. It'll take some time, more than a 2-week window, that actually looks at what is 5 years or before, if it's 10 years or before, what are we looking at here to actually quantify what it is? If it's 5 years or before, there's $70 million approximately in property taxes that are past due 5 years and older. But then you have approximately $150 million worth of retroactive wages. Remember, not all people that have retroactive wages no longer working in the government. Some might be deceased. There's a lot of pieces to this puzzle that the analysis has to be done that's going to take time. It's not going to be an overnight thing that it's going to happen like I'm going to actually say, well, okay, we can do a 1-for-1 or a 2-for-1. It's very different. So it takes a lot of time.
What is the number in retro that you just give out?
In excess of 100 million.
In excess of 100 million. Now, what would this do to your projection? Because you guys have projections, and we're thinking about now kind of dipping into your projection. What would that do and make it have a shortfall with your projections?
But it all depends on what you structure the bill as. As I said before, if it's 5 years or older or 10 years or older, it's a different impact. If it's 10 years or older, imagine 10 years, if you owe for 10 years, I look at it as you owe for 10 years, either you don't want to pay, you have the inability not to pay. In that case, if you have retroactive wages, and especially where you're now choosing a funding source such as the Southern Trust Settlement Fund, this is outside funding that actually would pay the actual bill. But in the case, if you're going to the general fund, that's where the impact comes. So it's many different, the bill has to be very concise in what sources we're using to actually offset. Because if it's using a source such as the Southern Trust Company Settlement Fund, that's an outside source that doesn't impact the general fund. So here it is, that cash moves from one place that restricted to now available for the government to use. But if it now if now you choose the general fund, now you're impacting your ability to actually pay for services, et cetera. So it's two different directions you're actually going here. So I think for me, the bill actually needs more work at this point, actually with a collaborative effort where we sit down with the senator and go through the process and determine here's what we actually want to do and how we want to do it and what source we're going to use.
And then I think my final question, it might not be to you, but probably to Mr. Leerdam. Have anyone did an assessment of how many government employees that is owed retroactive have property that owes tax? Have there been any kind of assessment like that done?
Senator, the Office of the Lieutenant Governor does not have access to that information. So there's no way we can do an analysis without the information.
Thank you very much. And then on the final bill, I really would have liked to see someone from the government office here, the AG office, to speak on behalf. I do agree that we need to do some kind of increase on the those figures as far as
30 seconds.
People being injured from the 25,000. I will support some sort of an increase, but I think some more information needs to be had, and I think someone from the government should have been here to represent the AG office, who's the one that handled these cases most of the time. Thank you very much, Mr. Chair, for the time. Thank you.
Thank you, Senator Johnson. Senator Fredericks, you're recognized for your 6 minutes.
Thank you, Mr. Chair. Good afternoon again, listening and viewing audience, colleagues, and legislative staff. Mr. Richards, good afternoon, sir.
Good afternoon, Senator.
I see this is my second lease agreement that I'm being asked to consider. I notice we're still with the same $100 a month situation, $1,200 a year. I'm assuming it's just coincidental, but I'm seeing a pattern here. Help me out with how do we come about, do we have some type of barometers that we're using when we're determining whether or not it's real property that we're leasing, land that we're leasing, or in this case, where it's really aerial space that we're really leasing with a small land portion? Is there some analysis that you do that helps determine what that pricing is?
Vincent Richards for the Department of Property and Procurement. Senator, this is your third lease agreement that you're considering from the Department of Property and Procurement, not your second. but I digress. The space is actually tower space, and you know, The charge that we're charging is at the minimal rate. It is for the federal government. The data that they do collect is for the public good. And, you know, I mean, I'll repeat for reference, there was a lease agreement before the previous body that was for the federal government to support the FAA, to support assisting aircrafts to land and take off safely, and that agreement was for $0. So I know this is an anomaly. It's not the norm. But again, just for perspective for yourself, for the listening audience, it's for tower space for attaching. I mean, when we look at these telecommunication towers and we see the edifice, the actual structure tower, but then when we look closely, there's a bunch of different pieces of equipment that are attached to the tower, and that's what you're actually renting is the right to attach your equipment onto that tower, and that's what this is for. I hope that answers your question.
Mr. Richards, in reference to the insurance aspect where there's no insurance being provided by the federal government, is there an indemnity language in there, hold harmless language in there? So in the event that there is any issues, that the federal government will in fact take full responsibility and absolve the Virgin Islands government?
The federal government, the U.S. government, just like the VI government, is self-insured and does pay claims based on the code section, the section of the code that addresses tort claims.
So there's not a hold harmless clause in there?
There is nothing. I'll have to check and see. I don't believe there's anything specific, but I'll tell you what. I'll have to review and get back to you on an answer on that, so I could answer properly.
Okay. One other quick point. Is there any escalation clause in your leases? Because I noticed they all tend to be pretty flat. So this is 20 years, and there's no increase in this lease amount over the 20-year period.
In this specific lease,
or any of the three that I've seen.
I apologize for speaking over you, son, Senator. In this specific lease, there's no escalation clause.
Okay. Thank you, sir. Let's go to bill number 36-0008.
1 minute.
In reference to the delinquency that we're discussing, $124 million, what is the administrative challenges we face if we're trying to start offsetting amounts owed by taxpayers against various government agencies? How do we administratively manage that process? And what is it going to cost us to do something like this?
30 seconds.
Well, Senator, Brent Leerdam, tax collector, there's a litany of issues that need to be addressed. For instance, you have various nuances where, for instance, a business owner may own a business in part, and they may want to have their property tax, their delinquent property taxes credited, but they're not the sole owner of the property. You know, so that's one small issue. There's also the issues of being able to validate a proof of debt. You know, as I'm just, if you have a proof of debt as being something that's signed by, say, a commissioner or agency head, what is the calculus that determined that that amount was that way? I mean, do we just have one person sign off on it and hand us something and we, you know, there's a litany of issues, as well as the administrative issues. There's the unfunded mandate of what it would cost for us to amend the system to be able to do whatever it is we agree to do. There's a litany of issues, Senator.
Thank you, Mr. Chair. Appreciate the time.
Thank you very much, Senator Frederick. Next, the chair will recognize Senator DeGraff. You recognize for your 6 minutes.
Go ahead.
Yes.
Okay. Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifiers, all listening, viewing, and present. Bill 36-0062. That parcel, I know exactly what the area is. It's a residential area with big communication towers, and they just want to rent a portion. I don't support it because really and truly the whole area needs to be, the towers need to move. They may have been there first before it was decided to parcel out, because I remember from police days when up on the hill were barren, just bush. But now Housing Finance Authority are leasing and selling properties around it. And how I found out about it, I went to check out, and the programs own a lot, build a home, or the VI Slice program for building property. And when I saw the monstrosities towers, I mean, it's like I was in the military in a radio communication unit, and I ain't gonna live near no tower. So I know, I have experience with them. I know we've put up towers for communication around the world. So again, that's what we need to do. So I don't support that first one. The second one, in regards to, in lieu of property, how much money in property taxes have we have collected from 2020 go back? Last year, the year before, if you have that information.
Well, each year, historically, we collect approximately 33 million in delinquent property taxes.
Okay, from 2020 go back.
That's historically been our track record.
Okay.
Yes, Senator.
Okay, so again, you don't have the information in regards to how many government employees versus that
No, Senator.
overall. Okay. And for Bill 36-0042, I understand the intent, and I got it. But I think right now, for me, in terms of the government, I don't know if to go from 25,000, are people owed more in payouts? Yes. But can the government sustain that? I don't see it right now. And for me, I'm not on, well, to pay this note, to pay out people 150,000, I'm gonna have to raise taxes someplace to tax the same people to pay them out the money. So I may have an issue with that going forward. But as for the delinquency of property taxes, just look at it. People are owed retro money who have passed away. 9 out of 10 times, the family may and may not collect. We've just appropriated some, so hopefully by end of May, they'll be able to collect something, the families. But with some of the people who are owed on other ends and who owe the government, it becomes I would see it as a win-win for the entire government to do it that way, because then the government doesn't have that debt. The person don't have that debt to the government. So I think it's at some point we have to look at ulterior or alternate forms of coming to a middle ground in regards to that. I understand collecting the revenues going forward, but then the government owes over excess of 100 millions, as the OMB director said, in regards to retro money. So property taxes, real life situation going on, retro money owed, real life situation going on. The only thing in the government that's dying are the people on the end of the retro. The property taxes, they may be dying, but hey, the families could be held accountable to take care of those. So again, it might be turn out a win-win situation for the government overall. You clear debt by taking care of another debt that you owe by somebody who owes one to you. So I think one and one, we could fill a basket and two hands could put together and clap. So I think just looking forward at it from an outside view and not having specific data as to how much money here, you mentioned 30-something $million collected from 2020 go back. That's every year for the past couple of years?
Yes, Senator.
Wow. That's
half of our projections.
Right. So is that a reflection of what? The people or the entity collecting? I ain't trying to be disrespectful, but is it the entity collecting or is it the people?
Well, we have a focus on collecting delinquent taxes, as well as we have a separate focus on collecting current year taxes. And so obviously we encourage people to pay while their taxes are current so that they don't find themselves in a final collection activity process where they could lose a property. But we have a separate process for delinquent properties that will chase behind and, if necessary, collect on those.
Excuse me, as Mr. Chair mentioned, that's a political answer. A good politician answer. So the question, but the question is it on the Lieutenant Governor's office or is it on the people? The people ain't paying or the Lieutenant Governor's office ain't collecting? In specific to the delinquent taxes from 2020 go back.
Well,
do you need assistance? Do you need more personnel? Is it your end or is it the people's end?
Well, we always need more assistance, as is evidenced by the plan that we gave you at the end of the 35th legislature and into the 36th legislature before the line of credit was approved. But aside from that, it's a reflection of, yes, we've stepped up our game in terms of collections, and people in turn have stepped up their game in terms of paying because, we've been communicating with them the importance of doing so and the end result of if they don't.
So a fair statement would be
1 minute.
You need to improve on your end.
We always can improve.
Okay, so that's one thing I was getting at, because I'm saying when you improve, then we may not have that delinquency because of the great job you're doing in bringing in all the money that you're bringing in for delinquencies. So
that's the possibility.
That's why I
Thank you,
see
Senator.
the bill as being a win-win, because until you're able to be fully complemented to take care of, imagine if you were fully complemented, we double that probably in delinquent taxes. But again, I think with people who owe retro money for donkey years, $100 million plus, it doesn't sound good. So if the issue is the government, where we could improve on the government's end to help the people, because at some point they're going to turn to taxing the people
30
because
seconds.
we're not collecting. So I think before we have to suffer for the ills of let's make a decision, I think we could try that. That's one way out. That's why the amendment is to make it specific to an area, because it was too broad. I agree with what you said, but I think in specifying regarding the retro, I think we will get some way. But again, thank you for your candor and continue doing the great work that you and your department does. Okay, thank you, Mr. Chair.
Thank you, Senator. If I may respond to that quickly. While we are aware of the hypothetical of if I had enough resources to do a better job at collections, it would result in more collections. It will have a definite impact if we go after that delinquent revenue that is part and parcel, 50% at least, part and parcel of our every year projection. So it will have an impact to the government of Virgin Islands in terms of paying their bills and keeping the payroll met.
Appreciate it. Thank you.
Thank you very much, Senator Graff and Senator Tax Collector, Mr. Leerdam. Before we go on to the next senator, which will be Senator Blyden, Senator Alma Francis Heidegger, you recognize your point of information.
Thank you so much, Mr. Chair. I'm going to tell you straight up, I don't support the amendment. And the reason being is that I was very excited for this piece of legislation when it first came forward because I thought it could help the whole community. But by only doing retro, we have now limited again, to just government employees. And I don't think that's a fair situation. And would you be amenable, and hopefully if this is accepted as an option, would you be amenable for us putting in a cap amount, a maximum amount that could be utilized? For example, if an individual goes and gets a judgment for $10,000, but we put in a cap that the credit can be no more than X amount of dollars, would you be more amenable to something like that? That way it would be open up to everyone versus us creating yet another legislation that is only limited to a handful of people versus benefiting the entire community. What are your thoughts on something like that?
Well, thank you for the question, Senator. If I may remind you, I serve at the pleasure of the Honorable Lieutenant Governor. And so it would be a group conversation that we have to have, as well as we need to, be certain that we have to conduct a study of it.
Okay.
So in fairness, I can't just answer that.
Okay. Well, I'm tossing the thoughts out there.
Thank you very much, Senator Francis Heidegger. Next, the chair will recognize Senator Blyden. You're recognized for your 6 minutes.
Thank you so much, Mr. Chair, and good afternoon to the testifiers, and thank you so much for your testimony. Let me ask in respect to bill number, let me start with bill number 36-0008, which allows for the offset of crediting of property tax liability against debts owed to the taxpayer by the government of the Virgin Islands. I know the current law now, as it stands in Title 33, Section 2494, allows the Lieutenant Governor's office to collect past due property tax liabilities by payroll deductions. With how many taxpayers would you say have the tax assessor entered into payroll deduction in terms of those agreements? Say within the last 5 years.
Well, the Office of the Tax Collector, which deals with all revenues pertaining to real property tax, we don't have any employees that I know of that have requested such a thing.
Really? Interesting. Interesting. Okay. It should be noted, though, in that respect, though, it should be noted that evidence of the debt must be consist of a court judgment or a settlement agreement signed by the agency head, correct?
Are you reading from the amendment?
It's a question.
Well, I'm trying to qualify the question, Senator.
The reason why I asked the question because the Lieutenant Governor can decide what is acceptable evidence of a debt owed by a GVI, by the GVI.
Well, to be clear, Senator, it wouldn't be fair to the Office of the Lieutenant Governor for us to have to decide what constitutes a valid proof of debt.
Correct.
And I can poke holes in it right now as it stands. So definitely, this bill would need more review to cover that. Yes,
okay.
sir.
Very well. I'll go to the next bill in light of that, which is bill number 36-0062, which is leasing a portion of a telecommunications tower to the NOAA to provide for weather and emergency broadcast transmission, which is very important to us in the territory. I thought it was a no-brainer at first, but then while the testimony was being read, an employee came up frantic and said her land is right next to that, and it's an issue because they are being forced to sign waivers. That's a problem. We can't have our people being forced to sign waivers because of what can transpire to them in respect to the power. So I cannot support her in good conscience being someone who is really, really in depth when it comes to housing issues and housing our people in paradise. So I cannot in good conscience support that. It will be irresponsible of me. So definitely I will not be supporting that. And lastly, bill number 34-0042, which increases the maximum award for damages against the GVI from $25,000 to $150,000. I know based on my research, when this bill was instituted in 1971, it was $25,000, and in today's dollar amount is $200,878.77 in today's money. So my question is, how much liability for damages have the government incurred in each of, say, the last 10 years? Do we know? If any?
Senator, I don't think there's a government representative to answer that.
Okay, very well. Also, I know the bill calls for the GVI to obtain insurance against such liability anyway, so what would be the cost for such premiums for the government based on that if the bill is implemented? What would be the cost of insurance if you know?
Senator.
Recognize OMB mic, please. Mr. Reimer.
Senator, it's been very difficult to determine how much you'll be able to cover because you don't know what the lawsuits would be.
That's true.
But to put a caveat on that, right now, based on the 25,000 you currently have, the government continues to struggle to pay settlements. So to now increase it 7-8-fold, you make the situation worse. So it becomes, you want to add more for the government to try to cover. That's why you have the cap. The cap restricts the ability for someone to basically just continue after the government. There's only one entity in the government that does not have a cap, which is WAPA. Everybody else has a cap, either $25,000 or $75,000.
1 minute.
Very well. Well, thank you so much for your responses. I'm good. I'm clear. Mr. Chair, thank you so much for the time. Thank you.
Thank you very much, Senator Blyden. Next, the chair will recognize Senator Clifford Joseph Sr. You recognize for your 6 minutes. And moving along, we'll go to Senator VLA. You recognize for your 6 minutes.
Thank you. Thank you, Mr. Chair. I'm analyzing the bills and trying to figure out what would be the financial impact to the government of the Virgin Islands. Looking at the amendment to bill number 36 as 0008, and realize that the amendment changes it to retroactivity, but testimony was really to the original bill. So I'd like to hear a bit more about the retroactivity. However, if a funding source isn't identified and you're going to utilize the retroactivity owed to offset the property tax, you're going to offset the property tax without any actual dollar collection. It's just going to be decreasing the debt of the monies owed in retroactivity, but it's not actual cash going to the property tax unless you have a dedicated funding source. You got a funding source, can be the general fund. That's a concern I have. Mr. Rama, you there? Is that a concern of yours?
Yes, sir.
I think that with this particular measure, we need to put just some more work into it. It probably is possible to come up with a mechanism, but some additional work need to be done, and we need to be, I mean, you're thinking about funding source and all that. I'm trying to figure out exactly how this could become law without causing a financial impact to the government of the Virgin Islands. Because at the end of the day, we're dealing with projections, and we got to make sure that there's not an impact. Now, in reference, I do agree that for bill number 36 as 0042, that there's a need for an increase. But absent the Attorney General being here, the Department of Justice, is hard for me to really determine that we should go ahead, because we need to get some numbers from them, number of judgments that we presently have. I'm looking in the fiscal year budget for FY25, and the money allocated for judgments greater than $25,000 is $250,000, which will take care of 1 3/4 of this measure if it was changed. So that number would have to, the $250,000 is literally 10 times the $25,000. And from testimony from the Department of Justice in the past, they have said that the $250,000 did not suffice. So if you do 10 times 150,000, you're looking at that appropriation being $1.5 million and still more than likely not being sufficient to cover the new increase. I would more than likely support an increase, but I don't know if I'll support an increase to 150,000 because once again, we would probably be doing something on paper that is not going to be funded by the government of the Virgin Islands. And we got to look at what is actually going to happen. You win a judgment and then you only allocate 250,000 a category or 500,000, then it limits the amount of individuals that can be paid. I would consider an increase, but we'd like to have some further discussion with Justice, and Justice should have been here to discuss how many cases, how many judgments are pending, etc. Mr. Leerdam, you said that we collect about $33 million in delinquent taxes per year?
Yes, Senator.
And how much become delinquent each year?
I'm sorry, could you repeat that question?
How much become delinquent each year?
Well,
in the post-audit report, they had some figures of, we have what, 120 something million in delinquent taxes now?
Yes. Yes, Senator. So every year.
One minute. Well, 1 second. The report provided by the post-auditor said that the property tax balance, delinquent property tax balance was $87.9 million in 2022. And by March 7, 2025, it had risen to 124 million. So that is in a 3-year period. So it looked like, despite the fact that we're collecting $33 million, it's like 40 something being added every year, which would be a 10 million difference. So those numbers are increasing. How are we working on that?
Those numbers are not correct, Senator. We're not talking apples to apples. If you're looking at,
okay, so
if I may,
go ahead. Give me the apples to apples.
If you're looking at property taxes, then that is without interest penalties and sewer fees, which raise it significantly. And so when I came into this tenure in 2019, the property tax delinquent liability was approximately 122 million. And so it ebbs and flows based on the issuance of property taxes. When they become delinquent, then you see a surge, and we work on the delinquencies after that. And so having come from 2019 at about 122 million to 2025, where it's 125 million, there has been no market increase in the amount of delinquencies that
30
exist.
seconds.
And so we're basically treading water and holding our own in terms of collections, but we want to make progress and not just have it remain stagnant.
So do you have an internal goal in terms of being able to decrease the number by 10, 15% every year until we get it to something that's more reasonable?
Absolutely, and I spoke to that goal in the response to the plan that was required of me for the line of credit. I spoke to that specifically in terms of resources that we would need to try and move the needle in a greater way.
Okay, because colleagues, when you look at property tax and you look at the other categories under internal revenue, we owe like $400 million that's out on the street. Those are monies that could literally balance this budget, and we don't have to be trying to find money here, trying money there to take care of the obligations of the government of the Virgin Islands. We just need those entities to step up the game, in terms of collection. Whenever the government of the Virgin Islands put out a notice that they're going to have an action, collections increase dramatically. So I mean that is, I know it takes a lot to organize it, but it's a revenue source that will collect significant monies, and we need to do the same with internal revenue. We're in tough times. Got to have some increased collection. Thank you, Mr. Chair.
Thank you very much, Senator Vielle. Ms. Modeste Elliott, you still have not posted your general fund revenues for March yet, and today is April the 15th. When is that going to be posted?
Probably early next week. We have been on target posting it by the 15th of the following month. So I know this is a short week. I didn't realize I wasn't posted already, but let me follow up with the team and probably could respond to you before I leave here today.
Okay, great. That's something we look at on a daily basis too, especially after the 10th. We figure that that's enough time for some posting and reconciliation to be done. So that's important. Senator Maurice James, you recognize for your 6 minutes.
Thank you, Mr. Chair. With respect to these three measures, when it comes to the lease agreement with NOAA, clearly the public is going to benefit from the transmission of weather broadcasts and emergency communication. So that's very straightforward. And as Mr. Richards states, it's really for the public good. And I don't have any issues at all with the amount that's being charged. There may be some other little things that have to do with in terms of the lease, for example, not putting some notice periods in, but overall I support it. With the property tax, property tax liability 36-0008, usually in situations where there's an offset, it's usually the opposite, where the government is offsetting a payment that's owed to the government, and not where the person is applying, the taxpayer is the one initiating it. So I wanted to find out with this particular process. Well, let me ask this. If the number of people who are owed retroactive wages, there may in fact be a number of those persons who owe property taxes. The way that the government right now, I more or less know the answer. The government right now, when it issues retroactive wages, it just issues the retroactive wages without offsetting any amounts due by delinquent taxpayers. Isn't that correct?
Yes, Senator, that would be correct.
Right, so the government just goes ahead and gives you whatever is owed to you without offsetting anything you owe them. And so this particular bill does the reverse, which is it places the government at a disadvantage, because it's only when the taxpayer wants to offset the amount due that they're delinquent and they're allowed to do so. So I have a lot of concerns with this measure, and the majority of what was offered in testimony by Mr. Leerdam, I agree with. When it comes to the last, the bill dealing with the damages against the government, bill number 36-0042, I fully support that. My focus is on the plaintiff and the harm that's done to the plaintiff in suits against the government. The government has to be held accountable. In today's world, I think one of my colleagues said that 25,000 in 1971 would be almost 200,000 now. So even the amount that my colleague has included in her bill is less than what would have been given in 1971. So I fully support that bill. Thank you, Mr. Chair.
Thank you very much, Senator Maurice James. Next, Senator Potter, you recognize for your 6 minutes.
Thank you very much, Mr. Chair. Good afternoon, colleagues, and good afternoon to our testifiers. The previous speaker mentioned that, in her opinion, that it places the GVI at a disadvantage. And I'm having a hard time really zeroing in on that, because we're talking about people who have been owed retroactive wages for decades. And I think, quite frankly, what has happened here is that we've owed this money for so long that we no longer really believe that it is a legitimate obligation of the GVI. So we're very, casual about this obligation, but it is a legitimate obligation of the government of the Virgin Islands. I mean, if you're telling me that a taxpayer owes $10,000 or $15,000 in outstanding property taxes, but the government of the Virgin Islands owes $30,000, that it is right and it is just and it is fair that the GVI can confiscate that person's property for owing $15,000 when the government of the Virgin Islands owes twice as much. People should pay their taxes, right? But the government also has a responsibility to pay their obligations. This is a duly negotiated salary adjustment that these folks negotiated. People are dying without even getting a hint of the money that is owed to them. I mean, I know we want revenues in this territory, but we also want the government to fulfill its responsibility to pay individuals, at least make an effort. That's what I'm saying, make an effort. And this, in my view, is a creative way for the government to do just that. I mean, I think fair is fair. I wanted to ask Mr. Leerdam, and I appreciate you, Mr. Leerdam, I appreciate you, your testimony today. Your testimony focuses on potential revenue reduction, right? But it doesn't address the economic benefit of resolving the government's debts. Isn't there any benefit? Is there any benefit for the government of the Virgin Islands reducing what is on the books as a debt, an obligation? For, even though it's old, it's aging debt, isn't there some benefit for the government clearing that off of the books?
Senator, I understand your concerns. Your concerns are valid. And obviously, it is important for the government to clear its debt. In a perfect world, having unified systems, this may have been a good bill at the time. At this time, with different departments, with disparate systems, with different types of levels of accounting being used in different agencies, yet having one unified audit being conducted by the government for the government of the Virgin Islands, we stand to put all of that at risk. Because when you speak about proof of debt, we have to be certain. And, you have to be able to show, just like how a judge would have the reasoning behind his judgments. You have to show that calculus of how you came there, because when the auditor asks the questions, who are they going to ask it to? They're not going to be able to ask it to the Office of the Lieutenant Governor, because we don't have all the answers.
I don't mean to cut you off. I apologize in advance for cutting you off. Hold your point, though. The government of the Virgin Islands spent, I don't know what the figure is, hundreds of thousands, if not millions of dollars, to put together a retro commission, right? To do their accounting and their assessment to determine what is owed to government employees who were not properly paid their retroactive salary adjustments. We invested thousands, if not millions of dollars to do that. So the Division of Personnel has in its database the specific amounts. When we are paying 22 million yesterday, it's not just random. It's because we have a certifiable amount that the Retro Commission calculated to determine what is owed. So we have that in place, and it's a matter of you can go on the Division of Personnel website right now and determine what is, and ascertain what is owed. I'm saying this bill, I think we tried to compromise in that the idea of, and I think Mr. Leerdam, you made the point, and it was a good one. I didn't see this loophole about people just saying, I am not going to pay my taxes right now. I can just wait for it to apply my retro. But we're saying no, and I think in a conversation with the budget director, we decided, okay, let's focus on the aging debt that we're not collecting it to that level. Let's focus on that to disincentivize anybody from saying, I can just chill and use my thing from the retroactive obligations. So, I mean, I understand completely, Mr. Leerdam. I understand your role as a tax collector. So I understand, But I don't know if this bill, regardless of what we did with it, I don't know if it would satisfy your requirement, or as far as saying, I support it.
If I may, Senator, I understand your position, and I understand the importance of, us paying our debts. But also remember, at this present time, half of my projections for the government of the Virgin Islands to do just that, to pay vendors, to pay payroll, and so forth, is based on this large amount of delinquencies that we're working to remove. And so until that is removed, and we can only focus on perhaps current year and get people acclimated to paying the taxes on time, it's still going to be a major hit to the government of the Virgin Islands.
Time.
And it's, Mr. Chair, if I might just wrap up. And I know we're speculating as to the major hit, because I think we're minimizing the impact by looking at the aging debt. So we're not looking at last year, or even the year before, or even the year before that. We're talking about 5 years and older. We are saying, I know you don't have the stats right now to support what I'm saying, but at least it removes the obligation from off the government's books. And I think there is value in us doing it. I know we want to get as much revenues to the territory's coffers as we can. I know. But we also need to have a regular mechanism to at least make people feel as though, there is some way that I'm going to see my retroactive or see something from it, because it's not just some pie-in-the-sky thing. It is a legitimate obligation of the government of the Virgin Islands. It's legit. And I think we are just, it's been so long we're just saying that it's, if they get it, they get it. It's not our priority. But I appreciate your testimony, Mr. Leerdam. Thank you very much. Thank you very much for the time. You could answer on the chair's time.
Thank you. Thank you very much,
Thank you.
Senate President Potter.
Thank you, Senator. Senator, we're collecting on those aged years. We're certainly collecting on them. One of the main ways is through the installment payment plans, which we've made easier in this administration for people to start them and to keep up with them. And so, again, we have that collection authority that doesn't expire. And so we do collect on it, but until we remove that large burden of delinquencies from off of the government, then, this bill eats into the actual government revenues. And so, perhaps during that day, maybe a different conversation. But right now,
Thank you very much. And, the painful part of this discussion always with the retroactive payment is that we have had civil servant, public servant, educators, and all these individuals that really went out and worked difficult time, dodged bullets, responded and put their life at bay and at risk for the government of the Virgin Islands, and we still have to nickel and dime and pay this in segments. So that's always that, and then we turn around and say that despite all of the sacrifices that you have made, we still prepare to sell your home and do these things without some consideration of being able, even if we can't offset. I think that at least a certification that this money is owed to them, that should avoid or at least stop any further punitive action against their property in that meantime. While there may not be a financial exchange, I think that there should be a mechanism once they could produce a certification that in fact IRB, Department of Finance or whatever owes this money, that there will be some opportunity that at least to stop the clock from impacting them punitively until such time as either side could make good and what's happening there. Because these people that owe this retroactive money have paid their dues, sacrificed their lives, and worked hard on the behalf of this government of the Virgin Islands. At this time, we need to take a quick 1-minute recess to change the recorder, and then we'll come back. And I think I have two other additional senators on this. The Committee of Budget, Appropriations and Finance stands in recess for 1 minute. And we are out of recess at this time. Again, we're in the Committee of Budget, Appropriations and Finance. And next, the chair will recognize Senator Alma Francis Heidegger. You're recognized for your 6 minutes.
Thank you so much. Good afternoon once again to my colleagues, to the testifiers, to the people of this territory and staff. As it relates to Bill number 360062, from my understanding, it's basically to rent space on an existing tower that is in existence. So my first question I want to know, how long has that tower been in that specific location?
Vincent Richards for the Department of Property and Procurement. Senator, I cannot answer that question. I want to believe it's been there for over a decade, if not 2 decades, Senator.
Because one of the concerns, just speaking to my colleagues that were concerned about residents in the area, et cetera, some have shared they feel the whole thing just needs to move. But I try to, and that's something I think we could dive into at another time. But if it's just specifically as to an existing tower and renting space, I can support that, because if it's going to benefit the people of this community as a whole by allowing that rental to go through. As it relates to 360008, the original version of this piece of legislation, while I understood what they wanted to do, I honestly thought it was too broad. I thought it left quite a bit of open room for abuse of the system. And that's my personal feelings. And when I heard the author had an amendment, I was expecting something more along the lines of coming up with a creative way that there would be some balance in the community, that as many people could utilize it, but it still has a cap so it's not abused. Examples of things for me would have been a maximum of X amount of dollars could be utilized. So even if you're owed $22,000 in retro, but the maximum that could be utilized is $5,000, I could understand that. And if it's a situation so that as many people could get an opportunity, somebody might say, hey, well, I owe X amount. We could put even a cap to make sure the government is not overburdened at a certain time at X amount of dollars on an annual basis that you can go up to in order to utilize this program. So for example, you can have a cap of $5,000 maximum, but on an annual basis, you cap off, say at $5 million. I'm just giving an example. That way, it would create a balance that as many people in the community could use it. It still has a cap so people could offset it, but then you still don't overburden the government on an annual basis if you just leave it open and you don't cap it off. So I thought it would have been something like that where it would have been more fair, because I would like to see people that are owed taxes. I would like to see people that are owed retro. I would like to see people that are owed judgments to be able to utilize it. I can't see where I heard the concern of my colleagues saying, we don't understand that this is a serious situation. Last night, this legislature again paid $22.5 million for retro. So we're fully aware that this is something that we are obligated to do. But I don't want us yet again to limit the opportunities of an entire community just to one small group. And that's where my concern is. Because we have to create legislation for the masses and in the best interest of the masses. And that is, I hope my colleague is listening, and maybe they could hash out a better way to do this with amendments and give everyone an opportunity to use it, cut down the ability of abusing it, and still cap the annual amount that it could be utilized. That is my solution for this. Now, I'm going to move on to 360042, which I am the sponsor of. And this piece of legislation, I think, is a long time coming, and I would like to thank my colleague in St. Croix that fully understands where I'm coming from as to why I feel this needs to be increased. I also understand the balance that we need as a government, but I also have to look at it, the 15 of us in here, not only is it our job to manage the government, but we also have to be the representatives of the very people that put us here. And if we are consistently not doing things or doing things that could block them from a situation where if we lick down somebody, we hurt somebody, and we're basically saying 40, 50 years later, you can only get a max of $25,000. A lawyer nowadays go eat up the whole $25,000, but the person is still hurt. And as a government, we still want to say, why should we be taking this type of liability? It's unfair. We have to do things to make sure whether or not we choose to clean up our own act, so we could have money if we do something wrong to say, hey, we're sorry that we did this, and we're going to try to compensate you. But the conversation I keep hearing is, we ain't got no money. But we're not saying that we ain't got no money because of our own mismanagement. We're not saying we're not going to have, because we up and down the place traveling every 5 seconds. We're not saying that. But we're saying don't do it because we just don't have no money. Maybe if we clean up our act, the money will be there. So, and sometimes I told my colleagues earlier, I speak about these things because these things I know firsthand. In 1992, my mother was knocked down on the crosswalk in front of Ashford by a government employee driving a government vehicle. And I remember she got a letter telling her that the maximum she could get is $25,000. That's 31 years ago. And they also said in that letter that they would pay for her hospital bill. My mother died 5 months later. from after she got knocked down, because what they were not aware of is when the gentleman knocked her down, she was leaving the island the next day to have surgery to remove lumps out of her breast. And because that accident happened, they didn't get it out and she died. She never got a penny. And I'm not upset because she never got anything. My mother was a forgiving person. But I stop and think about all the people in this territory that we have hurt over the years and never paid a dime for it.
30 seconds.
And we as a community have to do better as a government to protect the people that we're claiming that this government is supposed to be serving. And that's all I'm asking. And I am willing to be responsible and but we have to increase it. For 50-something years, $25,000, it's not fair. 40 years ago, our budget was $130 million. In 2024, it was $1.4 billion. And we still want to tell people, if we hurt you, the maximum we're willing to give you is $25,000. It's not fair. And that's all I'm saying. So I'm willing to work with my colleagues if they think the 150 is too much. I like to negotiate. They know that. Something that would be a happy balance, I'm willing. But we can't keep hurting this territory and telling them we're not giving them anything. That's all I'm asking. Thank you very much, Mr. Chair, for the time.
Thank you very much, Senator Alma Francis Heidegger. That was a moving conversation. Sorry for your troubles. At this time, the chair will recognize Senator Carla Joseph. You're recognized for your 6 minutes.
Thank you so kindly, Mr. Chairman. A pleasant good day to the testifiers and all people here in the chambers, including my colleagues and our listening and viewing audience. I want to ask a question of Mrs. Modeste Elliott. How are you doing today? That's not the question, but I just want to make sure you're okay. I'm good, thanks. My colleagues before me asked a question. Well, actually, she told you that we just paid out $22 million of Epstein funding that is going to go to retroactive wages. But I know she's a bit emotional, so she didn't ask you this question, and she has a bill on the agenda as well. But one of the things that we were having a discussion last night was the legislation that she moved regarding rescinding the pay raises for public officials based on the computation. Has there been any payout, do you know, for any public official, the governor, with the increases in the salary?
Not that I'm aware of. I don't know.
Oh, one moment. Kindly recognize the mic of Ms. Modeste Elliott.
Clarina Modeste Elliott, no.
The answer is negative.
Correct.
No one, not the governor, not the lieutenant governor, not any senators have received an increase on their salary. Correct?
Not that I'm aware of, no.
No.
Correct.
Okay. So we want to make sure that we are saying that and you aren't aware. Would you be aware?
Yes.
Okay. I just want you to say you're not aware, but I just want you would be aware. Correct?
Yes. Correct.
Okay. Very good. So we have made sure we let our listening and viewing public and every human being in the air shot and a view shot of the people house that we haven't received any increases in our pay and our paycheck. Okay. And today is tax day, and I want to just say I really appreciate tax day because I like to pay my taxes. I like to pay my taxes because in paying taxes, we see services. It says in the good word of God, render unto Caesar what belongs to Caesar, and render unto God what belongs to God. And I pay my tithes as well. So I wanted to first talk about the bill with the lease. I have some concerns, Mr. Vincent Richards, where the location is. Are you aware that there have been some cases of cancer in that general area?
Vincent Richards for the Department of Property and Procurement. No, Senator, I'm not.
Okay, so I'm aware that someone who lived within maybe 500 or 600 feet of that tower contracted cancer, and they are no longer on top of God's earth. I'm aware of that. So I have concerns regarding those towers being erected. What is currently on the tower?
Senator, I want to believe that there's a myriad of communication devices that support 911, including the VIPD for their communications to communicate with the VIPD, to communicate with the VI fire service, emergency services. I want to believe there's also equipment on there to support the cell phones that we have. And I know I look around, I see everybody with 1 or 2 cell phones. Also, I want to believe that there's other devices that measure wind speed, wind direction, barometric pressure, the temperature, as well as the Sahara dust as well. So
I appreciate all of that critical data that we need to be able to collect, but we have to start to look strategically in planning areas to put these towers. We know that in the far western part of the island, they have some towers down there, and the human beings who are residents there, they too have indicated they have seen a spike in the number of cancer cases, and our cancer center here is still being rebuilt, so we can't treat them. So it's an added cost to our healthcare system, and it's an added cost to their families to be able to take care of them, because not everyone has the ability to fly off island. Let us be mindful of that. And that's why I was happy to see the diabetes registry that was here, but I know the chairman is going to call in of the Committee on Health, Hospitals, and Human Services is going to call in those entities that are supposed to be keeping a record and collecting the data for the cancer registry as well. Now, I want to then focus on the bill, which my favorite, he is my favorite, one of my favorite employees and department is here to testify on, and that's regarding bill number 360008. I saw your reading, your testimony, and I'm in full agreement. You know, I'm not going to be in this. I'm sorry, Mr. Richards, you're not the favorite division. That's Mr. I'm sorry. I'm very sorry. My favorite division is the Lieutenant Governor's division of tax assessors and tax collectors. Those are my favorite people. They are doing their work. They know it. I'm going to tell everybody that's one of my favorite. Now, I am in agreement with you because, and I'm not in agreement with this amendment either, like the previous speaker. It is an issue when we are starting to segregate a population that is owed, that owe money. We have to be fair to all. I believe the governor once said in his testimony that about 77% of our population is in the private sector. I used to work in the private sector, and I owed money on my property taxes. I was going through life, and you know what I did? I went into the tax assessor's office, and I put together a payment plan. A payment plan. I was on a payment plan, and I paid my taxes. You got to pay your taxes, okay? Even today, and like I said, I went to pay my taxes. So I went there. I don't have any shame in my game. Okay? I paid my taxes because I know government workers need to eat. And we have an obligation to owe those persons who owe retroactive wages. My mom died. My mom was a lifelong government worker. And she worked very hard as a custodial worker here, making sure that in the Department of Education, making sure all the classrooms were clean and nice. I used to go and help her. And guess what? She's owed money. She has been deceased going on 8 years now, and she didn't see a dime of her retroactive wages. I haven't even seen a dime of it either, and I'm her survivor along with my brothers. So I understand the pain. I understand it, and they do that. We should not be negotiating in a system wherein you're not going to get your pay. That is wrong. And to do that is very disingenuous.
30 seconds.
And we should not be engaged in doing those. So I am not a member of this committee. So I am not able to vote on any of the measures before me. So I yield to the committee members to make the vote, and we will await when they come to the committee, which I have jurisdiction over, Rules and Judiciary, to see which bills make it out of this committee. Thank you so much, Mr. Chairman, for the time.
Thank you. Thank you very much, Senator College Joseph. Point of information, Senator Dwayne DeGraff, you recognize.
Thank you, Mr. Chair. I just wanted to bring to the attention of the tax collector, Mr. Leerdam, in regards to being that amendment is going specific toward retro payments to government employees. I don't know if you're aware that this body provided $25 million in retro payments, and only $2.5 million were paid in 2023, hence causing us to have to pay $22.5 yesterday that we put out for retro payments. We would have been ahead of getting employees their monies had that first set gone out and the second set being delivered. So we are trying to make the effort in regards to it to release you from, what we're trying to do, but that's where the intent of 36-0008 comes from. So just for your edification, if you weren't aware, that's what actually took place, and hence what triggered some of these type legislations. Thank you for the time, Mr. Chair.
Thank you very much, Senator DeGraff. Mr. Leerdam, have you seen the amendment?
I just recently saw it, Senator. Yes, I did.
So you need some time to be able to digest and maybe analyze the amendment?
Yes, I have my initial thoughts, but I'd like to discuss it in group before we come back again.
Absolutely, yes. Dr. Saldania Richards, you've been sitting there for a while, and you heard some of the testimony and the discussion in regards to Bill 36-0042. Any additional thoughts?
Dr. Felicita Saldania Richards, we think that possibly a group, a committee, some kind of entity that could discuss the amount that is owed with representation from not just one group but many, in terms of what the amount should be. But consider, as the senator was saying, that it's been 54 years since any change was made to the original legislation. Even if you paid $1,000 a year, that possibly wouldn't even cover the inflation that has occurred in the 54 years of since the original legislation. So we would appreciate input from many different segments on the matter. As the senator was saying, these days you end up paying out $25,000, $30,000 for settlement to attorneys for various suits. That is not considered. $25,000 in our present economy doesn't pay for a lot. But I will leave that to those who deal with numbers for a living every day and others in the community. But we stand in support of the legislation.
Very well. Thank you. Director Julia, any thoughts on the increase from 25,000 to 150,000 or somewhere in between. Any thoughts to that as the individuals responsible for cycling the money here or there?
As indicated before, Senator, right now, as we struggle to actually just pay the current claims, the risk of increasing it to this amount, it really just creates more issues. At this time, we need to really focus and let's look at it and determine if there's a policy needs to be put in place or there's something, other mechanisms to be put in place in order to move that actual needle. But 150,000 for me is really a stretch, and I don't think the government can afford it.
Thank you. At this time, I think that this rounds out. If any of my colleagues have any burning questions, I'll allow it. If not, I'll have the testifiers issue their closing arguments, and then we'll have a brief discussion and then take a vote on these bills. Any burning questions from my colleagues? Hearing none, again, I'll allow for a closeout. And we can start off with you, Mr. Leerdam, tax collector.
Thank you, Mr. Chairman. Thank you for allowing us the opportunity to submit testimony on this bill. I'd like to reiterate that the focus of the Office of the Lieutenant Governor is not just to collect on taxes, but we'd like to perhaps change the conversation rather than focusing on revenue to home ownership. And that was the purpose of getting that bill through, the in-rem jurisdiction foreclosure, which we're diligently working on to put the rules and regulations together so that we can create more home ownership opportunities. In addition to that, the Brian Roach administration has reduced the amount of, the Lieutenant Governor specifically has reduced the amount necessary to begin a payment plan from 25% of what's owed down to 15%, and makes it more feasible for people to do so, having up to a term of 3 years, 36 months. And the Brian Roach administration has made available $15,000 to homeowners through VI Housing Finance Authority to assist persons with delinquent property taxes, of which different persons are using. To this date, our goal for this year is some 560 payment plans, an increase over last year, and we're on target to hit, we're on schedule to hit that target. So I'd just like to say again, thank you for this opportunity to speak to this bill.
Thank you very much. Just a follow-up question real quickly. Have there been an assessment made on the number of homes that's abandoned or closure on these homes? Have the Lieutenant Governor's office, either the tax assessor or the tax collector, reconcile these various neighborhoods? As we go through the neighborhoods, you can see a number of homes that have been, some of them might be damaged and abandoned or just close up. Have there been any assessment, again, to kind of correlate what's happening in terms of our tax collections?
Thank you. Well, before I turn it over to the tax assessor to answer in more detail, I can say that in preparing for final collection activities in the territory, you often find a home that may have been damaged, years ago in a hurricane, but they've paid their taxes. And so it indicates that, they're just awaiting whatever additional funds to be able to actually repair their homes.
Mr. Romney, you have any additional on that?
Well, in the near future, hopefully we'll be doing the new revaluation, and at that time, we'll have more definite information on properties that are unoccupied but has some edifice on it. We have some that we go through, but some of them are also properties that are in probate that folks just have difficulty finishing up.
So in your analysis, you are able to categorize those areas, again, who might be in probate, the abandoned property, damaged properties. Is there a category created for all of those different areas?
Not necessarily, but once it comes to a point where we recognize the property and there is delinquency, then in the evaluation of going to completing the process of collecting what's owed, that's when the tax collector office finds out whether a property is in probate or not, because that one doesn't go to auction. But in our assessment, we are looking at the value of the building as well as the value of the land to determine the assessed value, as well as to determine what category it falls in, whether it's commercial, residential, and so on.
Okay, thank you. Thank you for that response. Assistant Commissioner Richards?
Mr. Chairman, I'd like to say thank you on the behalf of the Department of Property and Procurement and Commissioner Lisa Alejandro and the hardworking employees of the department for this opportunity to testify on this lease agreement. I'd like to reiterate that the equipment that's being placed on, or that it presently exists on the towers, is to measure wind speed, measure wind direction, measure barometric pressure, temperature, to measure Sahara dust, and also, I'm looking at my computer here, and on the bottom left-hand side of my computer, it tells me about weather data, and this is the information that we use every day to make the decisions that we make in terms of whether we're going to go boating, whether we're going to take an umbrella out of the house with us, or take a raincoat with us. So I understand the concerns that are raised, but the equipment that's placed in the tower is just there to measure weather data. So that's that. Other than that, I'd just like to say thank you. One other point, I believe Senator Frederick asked about insurance and indemnity, and I just want to refer him to section 6.01 and section 6.02 to see, to answer the questions about the federal government's insurance policy. So other than that, thank you very much, and I look forward to being back down here again real soon and real often.
Thank you. Thank you. Assistant Commissioner Richards from the Department of Property and Procurement. Next, we'll go to Dr. Felicita Saldana Richards.
Dr. Richards for the League of Women Voters. The League thanks Senator Heiliger and the committee for the opportunity to speak on this bill. In summary, the League is in full support of raising the ceiling, but we cannot speak to what the ceiling should be at this time. We would be happy to provide feedback on this latter point in the near future. Again, thank you for the opportunity to comment.
Thank you very much. And tell Dr. Gwen Molina she's done a good representative, and thank you for all the work that you have done. You did a good job today.
And other committee members.
You're welcome. All right. At this time, this concludes your presentation as testifiers, and we'll be taking a 10-minute recess to discuss the measures before us, and then we'll take a vote on it. The Committee of Budget, Appropriations and Finance stands at recess for 10 minutes. And we're out of recess. Again, we're in the Committee of Budget, Appropriations and Finance on this April 15th, 2025 tax day. And we're in block number 2. Do I hear a motion? Motion. Senator Fonseca, you recognize for your motion.
Thank you, Mr. Chair. Mr. Chair, I move Bill number 36-0062, an act approving the lease agreement between the Government of the Virgin Islands, acting through its Commissioner of the Department of Property and Procurement, and the United States Department of Commerce, National Oceanic and Atmospheric Administration for a portion of the telecommunications tower located at parcel R-22 of Track 1, Estate Nazareth, number 1, Red Hook Quarter, St. Thomas, be held in the Committee of Budget Appropriations and Finance for further review and consideration. I so move.
Motion properly made by Senator Fonseca, seconded by Senator Blyden and Senator DeGraff. Roll call.
Senator Marvin Blyden? Senator Blyden, yea. Senator Dwayne DeGraff? Senator DeGraff, yea. Senator Ray Fonseca?
Yea.
Senator Fonseca, yea. Senator Norville Francis Jr.? Senator Francis Jr., yea. Senator Hubert L. Frederick?
Yes.
Senator Frederick, yeah. Senator Maurice James?
Yes. Yes, hello?
Yes. Senator Maurice James, yes. Senator Curtis Vele? What did he say? Senator Vele, yes. Senator Vele, yes. Mr. Chair, 7 yeas.
Thank you very much, Madam Clerk. Bill number 36-0062, an act approving the lease agreement between the Government of the Virgin Islands, acting through the Commission of Property and Procurement, and the United States Department of Commerce, National Oceanic and Atmospheric Administration for a portion of telecommunications tower located on parcel R-22 of Track 1, Estate Nazareth, number 1, Red Hook Quarter, St. Thomas, Virgin Islands, have been held in Committee of Finance, a Committee of Budget, Appropriations and Finance. Do I hear a motion? Motion. Senator DeGraff, you recognize for your motion.
Thank you, Mr. Chair. I move Bill number 36-0008, an act amending Title 33, Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset the property owner's property tax liability against any amount of money that the Government of the Virgin Islands owes to the property owner, be held in this committee at the call of the Chair, to be held in the Committee of Budget, Appropriations and Finance at the call of the Chair. I so move.
Motion properly made by Senator DeGraff, seconded by Senator Blyden, Senator Fonseca. Roll call.
Senator Blyden? Yeah. Senator Blyden, yea. Senator Dwayne DeGraff?
Yes.
Senator Dwayne DeGraff, yes. Senator Ray Fonseca? Yeah. Senator Fonseca, yeah. Senator Norville Francis Jr.?
Yeah.
Senator Francis Jr., yeah. Senator Hubert Frederick?
Yes.
Senator Frederick, yeah. Senator Maurice James?
Yes.
Senator Maurice James, yes. Senator Curtis Vele? Senator Vele, yeah. Mr. Chair, 7 yeas.
Thank you very much, Madam Clerk. Bill number 36-0008, an act amending Title 33, Virgin Islands Code, Subtitle 2, Chapter 89, Subchapter 1, Section 2494, requiring the Lieutenant Governor to offset a property owner's property tax liability against any amount of money that the Government of the Virgin Islands owes to the property owner, has been held in the Committee of Budget, Appropriations and Finance at the call of the Chair. I hear a motion. Senator Blyden, you recognize for your motion.
Thank you so much. Mr. Chair, I move that Bill number 36-0042, an act amending Title 33 Virgin Islands Code, Subtitle 3, Chapter 118, Section 3411, to increase the maximum judgment amount for the award of damages against the Government of the Virgin Islands, be held in a Committee on Budget, Appropriation and Finance Until a call of the chair, I so move.
Motion probably made by Senator Blyden, seconded by Senator Fonseca, Senator DeGraff, Senator Fonseca. Roll call.
Senator Marvin Blyden? Senator Blyden, yeah. Senator Dwayne DeGraff? Senator DeGraff, yeah. Senator Ray Fonseca? Senator Fonseca, yes. Senator Novell Francis Jr.?
Yeah.
Senator Francis Jr., yes. Senator Hubert Frederick?
Yes.
Senator Frederick, yeah. Senator Maurice James?
Yes.
Senator Maurice James, yeah. Senator Kurt Vele? Senator Vele, yeah. Mr. Chair, 7 yeas.
Thank you very much, Madam Clerk. Bill number 36-0042, an act amending Title 33 Virgin Islands Code, Subtitle 3, Chapter 118, Section 3411, to increase the maximum judgment amount for the award of damages against the government of the Virgin Islands have been held in the Committee of Budget Appropriations and Finance at the call of the chair. Again, this concludes this hearing. I want to thank everyone for their work on these measures. And point of personal privilege, Senator Alma Francis Heidegger.
Thank you. I just want to quickly say I would like to thank my colleagues who are on the Finance Committee. After discussing it with them, we have decided that yes, we would like to increase this, but we would also like to have further testimony from the AG's office. And hopefully we will come to an amenable number so that the people will benefit from this piece of legislation. Thank you, Mr. Chair.
Thank you very much, Senator Francis Heidegger. Again, all of the measures before us today were good measures. However, it requires some additional deliberation after hearing from our testifiers and contemplating how the path forward and these measures. So there'll be some additional work done on these 3 bills, and then they'll be brought back to the Committee of Budget Appropriations and Finance in the very near future. Again, I want to thank the central staff, the post-audit division, of course, for doing their due diligence on these measures, our reporters, media, public affairs, security, everyone involved in today's proceedings. Thank you very much. My staff, thank you. And thank you to my colleagues. And we look forward to a hearing tomorrow, where we have a hearing with the Economic Development and Agriculture. The committee hearing of the Budget Appropriations and Finance of April 15th, 2025 is hereby adjourned. God bless.